A very warm welcome to all of you. There is a world of difference between the knowledge you gain from books and the wisdom you receive from experience. And to fill this gap, SITARAM Research Foundation initiated AACHAARA RASAYANAM. This is a continued medical education program for Ayurvedic practitioners as a part of SITARAM Ayurveda's 100th year celebration. With 19,000 plus participants, 150 plus speakers, 175 plus different topics, and 100 plus clinical sessions, AACHAARA RASAYANAM has been a huge success and has contributed significantly in helping Ayurvedic doctors embark on a lifelong learning journey. With this CME, SITARAM brings together excellent minds on Ayurveda whose rich expertise in clinical practice will contribute to your growth and learning. SITARAM started its healing journey in the year 1921 with a state-of-the-art GMP certified manufacturing plant, government-approved R&D laboratory, super speciality Ayurveda hospital, and an NABH accredited Panchakarma retreat. SITARAM continues to serve people with the ancient healing powers of Ayurveda. Thank you for joining us in this episode of AACHAARA RASAYANAM. You will be receiving the show notes, certificates, webinar recordings, and the latest updates onto your email and WhatsApp. To receive the latest updates and newsletters, please send a text to 8943 441 881. For more details, log on to our website www.sitaramayurveda.com and welcome to AACHAARA RASAYANAM.
Good morning all. A very warm welcome to all the doctors, participants and panelists who have joined us for today's 287th episode of AACHAARA RASAYANAM organized by SITARAM Ayurveda. I am Dr. Manisha KS, Junior Officer, Research and Development Department, and it is my privilege to be your host for today's session. Today's topic is Practice of Vajikarana Tantra as a Speciality, a roadmap for precision reproductive medicine. On behalf of SITARAM Ayurveda, I extend my heartfelt gratitude to the esteemed speaker and the attendees for being part of this enlightening session. Let us begin today's program with a great enthusiasm and a spirit of learning. Today, we are privileged to welcome Dr. Pankaj Sharma, a distinguished Ayurvedic physician, researcher, and academician. A university rank holder during both his undergraduate and postgraduate studies. Dr. Sharma is currently pursuing his MD in Kaichikilsa with specialization in Rasayana and Vajikarana. He is widely recognized for his contribution to Ayurvedic research, reproductive medicine, and integrative healthcare. Dr. Sharma has authored 4 books and published more than 45 research papers in reputed national and international journals, including Scopus and Web of Science Index publications. He has received numerous national awards and has presented his work at prestigious academic forums across India. With his deep knowledge of classical Ayurveda and commitment to evidence-based practice, Dr. Pankaj Sharma has emerged as one of the promising young scholars in the field of Ayurveda. We are honored to have him with us today to share this valuable insight on practice of Vajikarana Tantra as a speciality, a roadmap for precision reproductive medicine. Doctor, a warm welcome to you.
चतुर्मुख समारंभां संहिताकार मध्यमां अस्मदाचार्य पर्यन्तां वन्दे गुरु परंपरां सहस्रांशुं गणाधीशं स्वगुरुं च सरस्वतीं जनकं जनयित्रीं च शास्त्र आदौ प्रणमाम्यहम्. Vaidya Shri Pradyumanacharya, he wrote a book called as Rasi Yoga Shatakam, where he has mentioned this first shloka describing the glory of Ayurveda. Ayurvedo Jayatu Satatam Bharate Vishwavande Nauka Bhuto Gadjalanidao Machitam Manavana Aryaihi Taradyaihi Muniganvaraihi Sushrutacharya Varyaihi Nito Dharade Jagati Yashase Rugvidam Shreyase Cha. He says victory is conferred on the science of Ayurveda, which is practiced by Acharya Sushruta and other sages like him in this land of Bharata, that is India. This land which is recognized and saluted worldwide to save mankind from drowning in the ocean of diseases. Ayurveda comes and becomes as a boat. With this salutation, pranam to this glorious science of Ayurveda, I begin my talk with offering My heartfelt namaste to everyone present here. At the outset, I have to thank respected Dr. Ramnathan sir, Dr. Vignesh sir, Dr. Anjana madam, and my teachers at SITARAM, Manachan sir, Bhagwati madam, and all other people who have been there and who made me come on this 287th episode of Achara Rasayanam. Before we begin this session today, uh, there is this worldwide quotation from Acharyas. Charaka and Vagbata both have mentioned the same. Acharya sarvacheshtasu loka eva hi dhimataha. There is no one rival or friend in the world. We have come here just to learn from everything. That is, there is no limit of the scope of science anywhere in this world. We have to be just alert and receptive while taking that knowledge. And it doesn't matter from where it comes. It can be coming from a teacher, it can be coming from a friend, it can be coming from an animal, from a tree, from anywhere. In fact, the whole world is a teacher. For a wise and for an enemy to the foolish. So, with this good words from Shastra on this beautiful Sunday, uh, though it's a Cancer Survivors Day today, and that goes towards the primary specialty which I have been trained in, that is Rasayana Tantra. But today we are going on the second part of the thing, that is Vajikarana Tantra. So, we have come here today to get something out of this Vajikarana Tantra as a specialty practice. We are going to discuss something about the roadmap for a precision reproductive medicine. I'm putting a word precision here in the specifically in the domain of reproductive medicine. Vajikarana Tantra predominantly deals with two things in Ayurveda. That is, one is the reproductive domain, and second is the sexual domain also. So predominantly in this slides, in this session, we will be able to learn something how we have to achieve to a better diagnosis, better treatment, better outcome to have a healthy child. So, what are our learning objectives predominantly? We will have some overview about Vajikarana Tantra, some basics, because it is not just ki we will be just taking about something from the Tridosha Siddhanta, Dosh Dhatu Malno, some core Vajikarana Tantra elements. Then something which is the evolved semen analysis in the domain of Vajikarana Tantra, which is called as Reto Pariksha. Then, since it is a precision reproductive medicine class, so we have to understand the systematic evaluation of male and female infertility in today's domain also in a stepwise manner. Then I have some clinical cases for you, which we will be discussing in later stages. Then, kind of a therapeutic snapshot, which will able you all to have some idea about how the treatment principle works in the domain. Then, some idea about the teaching and training in the domain, and in the end, we will be concluding it with the some recommendation which are worldwide, which we have to practice as an Ayurveda practitioner, and we will conclude the slide with some good note. And what I'm not going to deal is, I'm not going to deal the predominantly those Dhatu Siddhantas. I'm not going to deal in the anatomy physiology. I'm not going to deal the menstrual disorders, PCOD, the updated POMS, and the some sure sort formulations. And we are not here for that specifically. We are here to understand how the things work in the domain of reproductive medicine. Since for the undergraduation in Ayurveda, Vajikarana Tantra is a left subject. We understand gynecology, Prasuti Stri Roga, but as a Vajikarana, we are specifically in the domain of male infertility and female infertility, I'm saying. So we are not sensitized about the same in that depth. But at the post-graduation level also, we are having not that much inputs if we are taking from the lens of Shalya Tantra also, we just go in the domains of urology spectrum. If we are going into the domain of Kaya Chikitsa, we just go into the domain of some understanding of Dosha Dhatu Mala Chikitsa at the level of infertility. If Prasuti Stri Yoga, we are good in the female infertility management, but somehow we lack somewhere in the domain of male infertility. If we are in the Dravya Guna, we are lacking in the core Chikitsa protocols, but we are strong with the medicines which will be helping in infertility. So, as a part of when we are learning about Ashtanga Ayurveda, we should have a comprehensive view about this Vajikarana Tantra as a specialty from Kaya Bailagrihodvanga Shalidhansha Jaravishan. From Kaya Chikitsa to Vajikarana Tantra, we are having a compound set of uh, what we should call it as a guidelines, the roadmap, which is mentioned in the Samhitas by Acharyas. From Kaya Chikitsa to Vajikarana Tantra, we have to take everything into account whenever we are dealing with a couple who is longing for a child. And longing for a child is not a very small issue. The entire family is behind a single to get a single child. So it is so categorical that Acharya Vagbata has to write something very peculiar when he was telling about how important a child is to a family. So let's start with the section one, and let's recall Acharya Vagbata when he said, "Skarat Gamanam," he's not able to walk properly. Avyakta Vachanam, he's not able to talk properly. Dhuli Dusaram, he's totally covered in this soil. He's just not able to walk. He's just crawling in that soil. Api lala avil mukham. His nose is running. His mouth is watering. Still, Skalatagamanam Avyaktavachanam Dhuli Dusaram Lala Avil Mukham. Still, Hriday Allahadakarakam. Still, he's so, in Hindi we say Ganda, but still, Hriday Allahadakarakam. It is giving that peace, that joy to the heart. Because Apatyam Tulyatam Kena, Acharya Vagbata says, Apatyam Tulyatam Kena. What could be more equivalent towards like that Apatya? Apatya is something coming from Apatyapatha, the child. Because his darshana, sparshana, rishu, kim punaryat, yasho, dharma, shri mana kulavardhanam, mana shri kulavardhanam. This that small child who is soiled in that mud, who is not able to walk properly, one day he will be yasho, dharma, man, shri kulavardhanam. He will be taking that legacy of our family towards the next generation. He will be making that money what we are making today into 2x fold or 3x fold. He will be taking our glory towards the next level. She also, I'm not talking about he, it is just a apatya word I'm describing here. See how beautiful it was when Acharya Vagbata concluded the 40th chapter of Uttar Tantra, last chapter. Skaratagamanam, Avaktavachanam, Dhuli Dusaram, Lala Avilamukam, Hriday Alladakarakam, Apatyam Tulyatam Kena, Darsana, Sparshanalishu. Even if you want to see that child, if you want to touch that child, you want to hug that child, you want to take that child into your lap, Kim Punaryat, Yasha, Dharma, Shri Manakulvardhana, Man Shri Kulvardhana. So, with this idea, we have to talk something. And what we have to talk is we need to talk that there is a trend, the surging trend in India predominantly of infertility cases. More than 20% is in these top 8 to 10 states. I'm hailing from a state, Himachal Pradesh. So, right now I'm in Belagavi, Karnataka. These both two states from where I come and where I'm residing right now, both are having more than a 20% of infertility rates in India. See, other states, Goa is there, Karnataka is there, Tamil Nadu is there, Telangana is there, Sikkim, Delhi. They're having more than 20% of um, infertility rates. And also, see, this is one more data also that 42% of the women having concern about age or lifestyle in getting pregnant. There is some issue in the lifestyle. There is some issue in the mentality is also changing. See, there is a trend which is coming that people want to get married but don't have to have a child. This is also a trend going on. 45% of the female feels anxious and stressed about that conception thing. And whenever we are looking into our OPDs, we also have this uh, primary diagnosis. It is not that the parents are not able to conceive. No, it's anxious to conceive. And that anxious to conceive is something different from the organic cause, which is causing that infertility spectrum. And to a large thing, what we have to talk is only 1% of infertile couple are referring to going to a doctor to check whether there is some issue with us. How can a doctor help us? And with that help, can we achieve a goal? The goal is simple: conception, a proper 9 months of gestation, and then a healthy boy or a girl delivered. That is the only uh, objective that we are going with when we are talking about something called the infertility domain or the reproductive medicine. I'm very much categorical when I'm saying this reproductive medicine, sexual medicine. See, uh, I'll tell one standard line from American Society of Reproductive Medicine. It says, um, It is not important to have an orgasm to have a child. It's a very good statement predominantly. But when we talk into Ayurveda, we need that harshat, tarshat, paichilyat. We need that all components so that anupravan bhavat shukra prasichyate. Chakrapani also says, yada purushaha harsha rahita syat na tasya shukra pravartanam bhavati. If there is no harsha, there is no that component of libido, happiness, longing for something, it will not be of that use. But American Society for Reproductive Medicine has categorically stated that if there is no orgasm, there can also be a child. Orgasm is not responsible for having a child. It is just you have want to have a penovaginal interaction followed by a fertilization and that implantation of that garbha into the garbhashaya, and we will be having a child. So there is also this international scenario when the Lancet published this paper last year only, that middle income countries and low middle income countries are facing this infertility as a challenge, and when the uh, fertility rates are dropping very drastically in the worldwide spectrum, and we have to come to home in the end. And when we talk about India, India's fertility rate plunged in last 70 years, population to shrink further by 2050. This Lancet study only said that, but this clipping what I'm showing is just a part of that study. It is coming to nearly 1.5% and lower than that also. And in some data, it is being showed that in coming future, nearly 10 out of 5,000 or 10,000 would be a infertile couple due to our changing lifestyles, due to our changing dietary patterns, due to our work style habits, occupational histories, other things. Genetic predisposition also. See, we are living in an environment. For example, let me take myself only. I am living in an environment where my health is always compromised. I'm not taking a good food. I'm not exercising well, and kind of oxidative stress is being developed in my body. And when I'm going to reprocreate, I'm going to have a child. But genetic dosha dushti will be transferring from me to my child also, and it will be going for further generations. So if fertility rate is compromised at my level, that compromised fertility rate will be going to the next level also. And from that level, it will be traveling towards the next generation. And it is obvious that we have to take a mm, review about that. We have to understand the things, how the things are happening, and where we will be able to help those people who are specifically in need of uh, uh, direction, predominantly matter of help. It could be both psychological, mental, uh, aushad rupena, kaya rupena, vachik rupena, anything. It can be any kind of help. What, as a Vajikarana Tantra specialist, we can give to a patient. So, as we dive into the thing, Acharya Shushruta mentioned Vajikarana Tantra as Vajikarana Tantram Nama, Alpa, Dushta, China, Vishishkaretasam, Appenam, Prasado, Upachaya, Jananamitam, Raharsha Jananartham. There are four clinical categories and one psychosexual domain. That is Alparetasaha, where we have to take the Stoka Retasaha into component, which is Stoka means Teva Stokaha. From birth itself, from the puberty itself, it is Stoka. It's less in quantity, concentration, mobility, anything. Tesham Apyana Nimittam, we have to increase that. Dushta Retasaha, it could be Dushta due to Vadadi Dushta Retasaha. Retasa is a predominant what is coming out of the body. The seminal plasma, the semen component is predominantly what is called as the Retasa component. Shukra is predominantly the Bij Bhaga in that Retasa. We have to get it very clear there. If it is Vatadi Dushta, we have to do the Prasada. We have to do that Dosha Dushta Samurchana Bhanga. We have to do that Samprapti Devatana, where we can have a Prasada Rupa Retasa. That is Shuddha Retasa, Shuddha Shukra. In Kshina Retasa, which is Swamanat Alpibhuta due to Kim Karanas, any Karanas. So it is Swamanat Alpibhuta. Earlier it was of a XYZ composition, now it is of ABC composition. It has changed. So there we have to do that Upachaya Nimittam. And the fourth component, Vishwashka Retasa, it is Swamanat Atyartha Kshina. For example, it was 1 ml, it is coming to 0.2 or 0.1 ml. So it is Atyartha Kshina. In that condition, we have to do that Janana from the starting phase only. From where that Retasa Janana, Shukra Janana is happening in the body. From there, we have to cater that process. So, it is very important to note that Rasayana and Vajikarana Tantra specialties are coming together. So Acharya Charaka said, तद्वृश्यम तद्रसायनम स्वस्थस्य ऊर्ध्वस्करम किंचित किंचित आतस्य रोगनुत. And later he said तद्वृश्यम तद्रसायनम. And Chakrapani quotes, everything, every drug in the world is having the three components. It could be pradhanya bhuta औषध रूपेण, then it could be रसायन रूपेण वाजिकरण रूपेण. It could be predominant रसायन रूपेण वाजिकरण रूपेण औषध रूपेण, and the permutation combinations can be n numbers. So that rasayana component is very important. That's why Acharya has said labhopaya vishyastanam rasadinam rasayanam, that sapta dhatu parampara, that sapta dhatu sneha parampara, that sapta dhatu shuddhi parampara, parinama padya dhatu nam parampara should be going on. And because of that rasayana component only, we will be able to have that good shukra and the component good ritsa in the body, and we will be able to have a good sexual life and the falusrupena reproductive life also. So the question is, what is required to conceive? We have everything, but what is required to conceive? We need a purushasya anupatha retasaha. What is that? It is nothing but the non-hostile semen profile. Striyasta apradushya yoni, shonita garbhashaya. There are three components. One is the yoni. Yoni is the anatomical description of the apatyapatha. Shonita. Shonita is the component which is responsible for the raja. In modern terms, we understand Shonit in the domains of that ovum, that oogenesis, that endometrial proliferation, that coming out of the menstrual blood, those cramps, those period things, pain, nausea, premenstrual syndrome, anything. Shonit component. Garbhashaya. Garbhashaya, the component where the implantation is going to take place. That garbha is going to take ashraya. That healthy reproductive organ of the female is very important. We should not have any kind of coming from the apatyapatha, vaginism should not be there. Ectopic vagina cannot be there. Cervical issues cannot be there. Cervical ectropia cannot be there. Cervical erosion cannot be there. Fornices should be open. Then the os should be open. The cavity of the this uterus should be good. There should not be any issue with the fallopian tubes. There should not be coiling of the fallopian tubes. Ovaries should be good. Their volume should be good. Oogenesis should be good. The volume should be less than 10 or 15 cc. It should not be polycystic. There should not be any block in the fallopian tubes. The osteas of the fallopian tube should not be infected. There should not be any hydrosalpinx. Or what I am able to convince here you all people is that this component is just the reproductive anatomy part of the stree. Then if its semen profile is good, stree shonita yoni and garbhashaya is good, then only if there is fecundability period. In that fecundability period, that the window when the couple will go into the intercourse, they can have a child. Yada bhavati sansarga ritu kale. If they are undergoing an intercourse or sex during that time, sansarge shukra shonita, then we can have that fertilization component. Sansarge shukra shonita. And then we can have a growth in the child. That garbha. And in that garbha, when the fourth month comes, as per Acharya Sushruta, we will be having Jivo avakramayati Sattu samprayogat. Sattu and Jiva are coming from the previous life only. But the first 3 to 4 months when we say द्वितीय शीतोष्ण अभी प्रपच्यमानानां महाभूतानां संघातो गण संजायते यदि पिंडपुमान स्त्री चेतपेशी, we have to talk about like that only. That components of vayu, pitta and kapha, those are nothing but the anila, soma, surya, are components of that agni component which is the coming from that loka purusha siddhanta in the sharira, which is making that sharira eligible for that jivo avakramati, so that in the fourth month chetna abhivyakti bhavati. If that jiva and sattva takes their seat, then only garbho abhinirvartate. It is not nirvartate, it is abhinirvartate. That means the child that we are getting out of the body after 9 months should be live, should be healthy, should not have any congenital anomalies, should not have any fetal anomalies, should not be a stillbirth, should not be a miscarriage, should not be an abortion. So here only Acharya gives us the entire profile of the complete evaluation of Vajikarana Tantra as a specialty when we are talking about the Stree and Purusha concepts in the reproductive medicine and infertility management. So, for what this evaluation is it needed? We saw this should be there. So if it is not there, we need evaluation. We need evaluation because there can be Shukra Pradosha, Shukra Dushti, Bij Dushti at the levels of some cryptorchidism should be there. Absence of testis can be there. Undescended testis should be there. Maybe there is ectopic testis. Narishanda sampraptis could be there. Like that is aharshanam, apraharshanam can be there. Male sexual dysfunction can be there. Apraharsha, like loss of libido. Aharsha, loss of orgasmic functions can be there. Vakri, there can be any involvement in the external genitalia, Pioneer's disease, hypospadias, epispadias, that is a defective opening in the urethral meatus can be there. Vimargamana of the Shukra can be there. It can be there towards the uh, Mutrashaya, that is urinary bladder. Retrograde ejaculation can be there. But the Shukra, kind of a obstructive azoospermia can be there due to some vasoepididymal block, some nodes, tumors, anything can be there. Spermatolith, something is called, and it can be a problematic situation for obstructive azoospermia. And Shukragatvata and Shukravritvata, the two concepts in Ayurveda, can also be responsible where the Shipra Munchiti, Chirata Munchiti of the Shukra, delayed ejaculation, premature ejaculation can also be reported. So if it is being reported, there should be a causative factor also. And that causative factor is Ati Vyayama, Ati Vyavaya, Satmanam Sevana. Ati Vyavaya, it is not just the Ati of the our sex organs predominantly. Ati Hasta, Ati Pada, Ati Jibha, Ati Twakka, anything. Ekadash Indriya, Ati Mana Prayoga. See, we have a problem which is called as sexual performance anxiety. So it's a Ati Mana Karma. It is Mithya Karma of the Mana. If there is Chinta, Dhyan in the Mana, we will not be able to achieve that Harsha. And as I already said, Chakrapani quoted, Yada Purusha Harsha Rahita Syata, Na Tasya Shukra Pravartanam Bhavati. There will be no ejaculation only. So what is the meaning of having a sexual intercourse? Ati Vyayamat, Ati Vyayamat. Sharira Cheshta Ya Cheshta, Steryartha Balvardhini. Anything what we are doing from the body in excess can also hamper the bodily functions where, see the last words, Maithunam Nacha Gachata. He will be not able to go into the proper Maithuna Karma. But there is one more point, Asatmananta Sevanat. And in today's world, Asatmananta Sevanat is one of the most important component what we are overlooking in the patients. Food habits, lifestyle habits, smoking, drinking, these abuse of the drugs, psychedelic drugs, anything like that. Caffeinated things, sugar, um, fat, trans fat predominantly, junk food, fast food, more of a non-vegetarian food. Though Mams Rasa is very good for Shukra Nirmati, but that component of Mams is also responsible for oxidative stress in the body if it is not in a controlled environment. So Satmananta Sevana, Dushi Visha component is there, Gara Visha component is there. We are having no fruit or vegetable without pesticides today. The dals, the lentils, the rice are all polished. We don't know what we are eating in today's era. So Satmananta Sevana is a very important component. Then also Acharya says, Guru Shitati Snigdhati Matram Samashanata Cha Rasavahani Dushyanti. So Rasa is also the component where the Paranam Apadya Mananam Dhatunam component is there, which is transforming into the Shukra as a Dhatu. Shukra as a Dhatu, I'm saying it is not as Avyava form. I'm talking about Shukra as a Dhatu component. Where the Chintanamati Chintanati is also the Mansik factor which is responsible for the Rasa Dushana. And that component which is coming from the Ahara, Guru Shitadi Ahara, is also responsible for that Rasavahani Dushyanti, that component which is doing that Dushti of that Rasa component. That's why Klebbe is also the Rasa Pradoshish Vikara. And Klebbe is also the Shukravaha Sroto Vikara. So Klebbe at the level of Rasavahani Dushyanti can be a different component, but at the Shukravaha level, it can be a different component. The same way, Akali Yoni Gamanata, Nigrahatati Maitunat, Akali Yoni Gamanata, before time. And Akal Ati Maithuna. Ati Maithuna, I would say, like, if uh, I'll tell you an example, like, if someone is having a sexual intercourse at daily levels, for example, we are having a sexual intercourse at daily level. So, in that condition, if I'm taking a semen sample on the next day, like 5 days, patient had a sexual intercourse, and the 6th day I'm having a semen sample. So, I will not be able to have a good morphology, good count, good motility in that sample. So that is one component, that ati maithunat shukravahani dushyanti. That shukra srotas is in a process right now. That dhatu parampara is going on to create that shukra as a avyava. That sperm I'm talking about. Also, if there is any shastra, kshar, agni, prayoga, like any kind of biopsies are there. Studies also show that testicular biopsy is responsible for reducing that sperm functions. There are published data about that. But there are published data that it does not create something. But 1 in 100 can be an issue. Kshara prayoga, chitwa chitwa patayati. It says kshara is responsible for doing that chitwa chitwa patayati of a kapha karma. Prakrita subalashlishma. It is very clear. That kapha component is very important because guru, shita, snigdha, manda, we need that all things to make a good shukra for getting that spatikavam dravasnigdham. So these are basic components which should be in our mind when we say that what were the basic causative factors in that Shukra Dushti, and what Shukra Dushti we will be able to achieve in that patient. So Shukra Dushti will be Shukra se doshat klebhyam. Klebhya is predominantly Tvaj Anuchraya, that is erectile dysfunction, not able to maintain the erection. Aharshanam. Aharshanam is loss of libido. Rogi va klebam. The patient can have no conception. I'm not talking about impotency or anything. I am talking about an organic cause which is leading to a non-conception of a child in a couple. Rogiva klebam, alpayu virupam va jayate. There are two components. There is a conception in such a patient who is having a shukra dosha. But in later stages, if that child is born to a that shukra doshi, so that child could be a cleaver. That can have an impotence from the birth itself, sterility. And alpayu, it can be an alpayu child. It can have a miscarriage, abortion, stillbirth, birth after death after birth. And virupam vajayate. There can be anomalies in the fetus. There can be fetal anomalies both at the level of phenotypic anomalies, genotypic anomalies. It is a very important component when Acharya was telling that Shukra is a bija component of the Sharira, and that bija component is responsible for procreation, and that procreation component is already dosha. So, Virupam va jayate, Alpayu va prajayate, Klibam va prajayate can be even Rogi and the child of that Rogi. Or न तस्य जायते गर्भः. If that doshaj Shukra is going to fertilize, न जायते गर्भः. There will not be any kind of conception, fertilization. If conception is there, fertilization is there, patati, there will be garbhapatana, garbhapata, garbhaprasavana, patati prasavati api. There will be either no fertilization, no implantation, miscarriage, abortion, or any kind of XYZ component which could lead to patati prasavati na chasse jayate garbha. There will not be any garbha. Shukram hi dushta sapatya sadram bhagate naram. So such kind of shukra will be doing badha in conception. So if that conception problem is understood at the level of shukra, it is very important to know how it is manifesting so that we can understand where the problem is happening in that process A to B. So problem is happening like bhayata, krodhata, the mansic factors. अभिचारात अभिचार both कायिक अभिचार वाचिक अभिचार मानसिक अभिचार आहारज अभिचार विहार अभिचार विचारज अभिचार any kind of अभिचार. This should not be done if you are doing like that. Food, lifestyle, antibiotics, medicines, steroids, food supplements, whatever we are indulging into, what is not necessary for our body. I'm very categorical when I'm saying this. Somebody can come and question me ki protein, we are not able to achieve that protein source from the food. That's why we are taking supplements. Yes, you can take supplements, but there is matra, kala, vichara. Matra shisyatah punah bal agni balapekshani. Simple. If everything is in matra, even the viruddhahara is good for the body. Acharya have said, if you are eating grita daily, you are doing vyayama, if your body component is good, if your agni is good, even that viruddhahara will be properly digested, and that parinama padyamananam dhatunam component of the kleda will not be dushita. That is also not a problem. But if it is good, If it is not good, still you are popping the pills, popping that scoop of protein powder, popping that XYZ component, popping that parishit ahara, refrigerated food with on the stalls in the roadside, anything. It will definitely going to create that oxidative stress in the body. And that oxidative stress is very important when we are talking about any kind of inflammatory pathway in the body. And when we are talking that inflammatory pathway, 100% there will be pushti of that parinam apadyamananam dhatunam component of the body. And that apadyamananam component is very important because that entire life of the human being is being nurtured by that. Snehamayam ayam shariraha. That sneha component is going to be dushita. And at that level, if it is being getting dushita, 100% there will be, see, I already mentioned, rasvahani dushyanti till shukravahani dushyanti will be there. If you think that I am just blabbering about the thing, we are going to see the next line. See, भयात क्रोधात अभिचारात व्याधि भी कशितस्य च. In Rog Anutpadniyam chapter, Acharya Bhagavata said that there is something which is called a Vyadhi Karshita. But Aushadha Kshapita is also there. We will be Vyadhi Karshita due to some Vyadhis. But Aushadha Kshapita is also there. If we are taking some kind of medicine which is causing any kind of derangement in our kledha, there will be Vyadhi Karshita and Aushadha Karshita concept. Let's say example. Kafe mande Vadi Pittotare. Jwara. Kafe mande Vadi Pittotare. विसर्प कफे मंदे वात पित्तोत्तरे ग्रहणी कफे मंदे वात पित्तोत्तरे वात रक्त फोर components different vyadhis same component कफे मंदे वात पित्तोत्तरे can be achieved by vyadhi can be achieved by aushadha. So what happens क्षतात चापि वेगात् चापि वेगघातात चापि धातूनां च संप्रदूषणात्. See, it is very important to learn that it is धातूनां संप्रदूषणात्. Dhatu is the parinam apadya mananam component of the body which is continuously nourishing the body, wherein the dosh dushti is going to happen. If it is due to all these factors, sampradushanat, it's going to be dushit by dosha prithaka samastava. It could be vata dushti, pitta dushti, kapha dushti, samastava, vat pitta kapha dushti. And if that dosh dushti of the shariraj element, dhatu is entire body, but if it is reaching towards prapya reto vahasira, it is not shukra vahasira. See, it's reto vahasira from where the shukra in the semen element is going to come out of the body. If it is prapya reto vahasira, where that spermatogenesis factor is going to take place, where that semen formation is going to take place, where that semen fluids are going to take place, prapya reto vahasira, shukram sampradushati yashu. 100% there will be dushti in the retas and then in the component of shukra. Got the point? Retas is the fluid which is coming out. Shukra is the bija component. So this is what we have to understand when a patient is coming to us. That this would have happened, Sampradushna, then Prapereto Vahasira, and now the Shukra Dushti is going to take place. If Shukra Dushti is going to take place, now I will be able to understand that, oh, it is Alparetasa, it is Dushtaretasa, it is Kshinaretasa, it is Vishwishkaretasa. And if I have a knowledge of reproductive medicine, I will be able to see that, oh, this Alparetasa is nothing but the primary hypogonadism, which is at the level of mind and at the level of testis or ovary. Testicular failure, my testes are not able to produce that sperm. There is maturation of spermatogenic defects in the testis. Tushta, there is abnormality, not only doshik abnormality due to doshic factors in that my seminal parameters. Kshina, there can be secondary testicular failure. Your mind is good, your brain is popping those FSH, LH into the body, but your testis is not responding. Vishishka nastaretasa. There can be severe oligospermia, count, concentration, motility, morphology can be hampered at drastic level. So this we understood that prapereto vahasira shukram sandushiti yashu. And the shukra is being dushit, then the shukra is the bij component. If that bij component is dushit, Acharya has mentioned, bij bhagar vandhyam jayate. Yada bij bhage upatapto bhavati. It is said like, यस्य यस्य हि अंगविवस्य बीज भाग उपतप्तो भवति तस्य तस्य हि दोषम आपद्यते. बीज भागम प्रदोषम आपत्ति किम जनयति बंध्यम जनयति. He will not be able to procreate in his further life, never, the child who is going to born. बीज भाग अवयव पूति प्रजम से जायते, but बीज भाग अवयव एक देशम which is परुष पुरुष करणाम, very important. बीज भाग अवयव एक देशम which is पुरुष करणाम, which is giving that male component to that body. If it is not okay, it is problematic, there will be Putrikam naam se jayate. It is nothing but that mosaic forms, those Klinefelter syndromes, XY components where there are issues in the sex chromosomes. Purushakaranam, it is very important. Purushakaranam, Strikaranam, Ekadesham, Bij Bhagam Avyam Jayate. Yes, it is very important to understand this also. Because this Bij Bhagav is in the genetic material only. I'm not at all saying that the Bij Bhagav is a DNA chromosome. No. I'm just taking an understanding that Bij Bhaga, which is inside that Bija, the Shukra, there is something which is responsible for doing that Kriya in the Sharira. And we have a component which is called as azoospermia factor in the Y chromosome. Y chromosome is a very small chromosome with a long tail and a short component. So it is having three levels of regions: AZF A, zoospermia factor, AZF, A, B, and C. So A is responsible for the sperm development. If it is lost, if it is deleted, then there will be only Sertoli cell only syndrome kind of presentation will be there. There will be no sperms, but only FSH will be very, very, very high in the body, but the body will not be, testis will not be responding because there is no testosterone. Sertoli only sends syndromes. AZF-FB, B is predominantly for the germ cell development, maturation of the sperm sites into spermatids, primary maturation. If it is lost, then there can be a maturation arrest. And AZF-C, there can be it leads to sperm maturation from spermatids, spermatozoa to sperms, motile sperms. If there is some kind of issue in the AZF-C component, there will be a phenotypic outcome will be changed in the sperms. So I have a case of this azoospermia factor with me. So we are going to discuss that also. But before that, where that Bij Bhaga component should we understand? Whenever we are telling a patient to go for a karyotyping or a complete exome sequences, we have to understand this component also. See, I have already told the topic. It is a precision reproductive medicine. We should know everything and we have to intervene on the lines of Ayurveda only. We have to understand at the lines of Ayurveda only, but we need to understand where that component is missing. Will we be able to do in something if this deletion of that Y chromosome microdeletion is there? So if we are suspecting something, what we have talked till now, we have to go for some lab work. And basic lab work in male infertility management is semen analysis, which is called as Reto Pariksha, which could be manual or computer assisted semen analysis, that is called as CASA. Basic hormone evaluation, FSH, testosterone prolactin, anti-sperm antibodies, DNA fragmentation index. If we are suspecting that there are some mitochondrial defects, DNA defects in the patient, so that multiple abortions, spontaneous abortion are occurring in the patient. The garba is not able to conceive properly till 9 months. Yes, we can go for a DNA fragmentation index. It is not available everywhere. So yes, karyotyping for Y chromosome microdeletions, whole genome sequences. It is not only that only XY component can be defective. The exome, the autosomal chromosomes can be autosomes specifically can be also defective. Testicular biopsy, if it is only Sertoli cell only syndromes, some tumors, some seminoma, and XYZ kind of things can be ruled out from testicular biopsy. Some high-end tests are also there which are not performed that routinely, like vitality test. Yes, we can do in our labs also, but capacitation, ecosome reaction, DNA, sperm DNA fragmentation, as I already told, telomere length, ROS, antioxidant capacity. These all are high-end tests and which are not available in all situations and places. Example, I am living in a Belagavi, which is a big place in Karnataka region. But still, we have to send a sample to Bengaluru only because labs are not here for processing that sample. So, like that. So, if a sample is coming to our lab, as an Ayurveda Vajikarana Tantra specialist, I am going to see that sample. And in that sample, I am going to see Spatikabam, Dravam, Snigdam, Madram, Madhuganticha, Shukram Ichchati. It should be Snigdha, unctuous, Ghana. It should be Ghana, means it should be thick in first, which is called as the coagulum state, and then it should liquefy. Pichiram, it should be liquefied. Madhuram, it's not about the taste component, it is about the pH component. As Acharya Sushruta was very categorical when he said about that Kshar Vidyadhyaya. If you people remember, it is like that Kshara Prayoga. After that, we are doing Prakshalana with the Nimbu Swarasa, that Amla Kshara Dharma. And if we combine that Amla Kshara, we are going to reach a Madhura component. That is nothing but the Madhura component here, that the pH of that semen should be within the range. What are the range? I am going to discuss right now. Reta Shuddha Vijanyat Spatikabam. It should be like Spatika. It should not be crystal clear. It should be opalescent, grayish white kind of thing. Bahlam. The quantity should be good. Madhuram I told. Snigdam Visram. Visram. It should not have a foul smell, odor. Guru Pichilam. It should be Guru. It should have a capacity to fall down. Adha Patana Shakti, like that. Shuklam. It should be whitish. Bahu. Bahu in two sense. Bahalam is component in the volume parameter. Bahu in the Bahu, if I'm going to see in the microscope, I know what is kind of Bahu, but here I am telling you the Bahu as a count component. Falavat Ashanshayam. If we are having such kind of a Shukra, Seman, Retas, we will be able to have the Phala. Phala is nothing but the conception. And Sushruta has said Spatigabam Dravam Snigdam. Spatigabam Dravam Snigdam, Madhu Gandhi, kind of a sweetish order. Kechittu Tailak Shodram Nibham. Tailak Shodram Nibham, the viscosity should range from Taila to Shodra. It's a viscosity component. It is not like it should see like Taila, it should be thick like Madhu. No. The consistency should range from nearly from Taila to Madhu. If you pour that Taila or honey, you know how it flows. It should not flow in drop, drop, drop. You got the point? No? It should be something which is flowing like a component, which is together, but it can disintegrate also. That's why after liquefaction, when the semen is deposited high into the furnaces into the vagina, it liquefies and the sperms travel into the internal os and go to the fallopian tube. So when we saw this is a component, we also have a Shukra Dushti component. This is a Prakrita Srupa and this is the Vikra Srupa based upon this Shuddhi only. So Charaka said, Velam Tanuruksham as the Varta component, Vivaranam Puti as the Pitta component, Pichlam Anne Dhatu Sanshishtam Avasadija as the Kapha component. Dushti Rupina. He also says, Bhavati Upahatam Shukram na Tadgarbhaya Labhate. If that Shukra is a Upahata. See, here the shloka goes with Venlam Tanuruksham only, but who is understanding the concept will know that if it is Kapha also, Tadgarbhaya na Kalpate. If it is Pitta also, Tadgarbhaya na Kalpate. Bhavati Upahatam Shukram na Tadgarbhaya Kalpate is one component of that, but understanding is much wider. Shleshmanam Baddhamargam to Bhavati Yadapichilam. It will not be able to go into that track of the vagina or the cervix. And Strinamatya Gamanata Abhigata Chakshadatapi Shukra Dushyati. This is a very big slok, very good component from Charak Chikitsa 30. And when I am showing you the image on the right side, see the rightmost image is of a normal Shukra, semen retasa. But the left side component are like different. First one, see, loss of spatikabam, loss of that ghana. You're able to see. The background is black and the light is going from front to the back end. But in the first, we are not able to see the blackish thing. That is not ghana. That means there is some difficulty, some issue in the component which is of the either count or either the fluids or something else. We will be able to see under the microscope. See second component. It's not bahalam, just alpa. Ruksha component is dominant. It is a Shoshanatva has happened. So, see, this is a very superficial component I'm talking about. I have a deep understanding of this, which we will see into the next section that we are going to see. But at the outset, I want you people to just have a look at this slide. It is one of the slides from my lab where I took this picture from my phone only. And see, what a great sample it is, not for the patient, for me. We are having all kinds of sperm defects nearly, from starting from some amorphous matter and some pin heads, no heads is there. Normal sperm is also seen. Some short coiled tail sperms are there. It will not be able to progress. Amorphous head is there. It is not completely matured. Some component of cytoplasmic residue is there. Tail defects are there. See, amorphous cell is there. Cell debris is there. Some pin head is also there. Mid-piece defect is also there. It will be issue with the mitochondrial defects. So, if such kind of semen sample I am seeing and patient is coming with a complaint of infertility, I know where I have to intervene. Not the reproductive medicine, the Vajikarana Tantra kind. I know which dushti is there. Acharya have clearly mentioned. I know I have to take up that understanding from where this understanding can be developed when I see under this microscope. And this is what we are going to see in the next section. That is Reto Pariksha. And we as a Vajikarana Tantra specialist are of this opinion that when Acharya Vagbata said Te Vyapeno Peshinabhyo Ado Madhyordo Sanshaya, it is a component of Sharira. And Sharira Avyav Rupena Vat Pitta Kapha segregation. Though Vat Pitta Kapha is in the entire body, but the segregation at the level of Avyav is above Hridaya Nabi Madhya, and Adho Nabi. So same, since Shukra, the component of Avyava, I'm talking about right now, not Dhatu component of Shukra. I'm talking about the Avyav component of Shukra, which is a form in itself. That is a sperm. It is a same body, head, midpiece, and tail is we are getting. That head is predominantly for the basic functions like acrosome, nucleus, etc. But pitta component is the mitochondrial functions, which is doing that, which is giving that component of energy to that Shukra, and the tail, the flagellar movement, which is helping the sperm to travel in the direction of os, uterine cavity, fallopian tube, ampulla, and then fertilization. So urdhva pitta, madhya pitta, sorry, urdhva kapha, madhya pitta, adho vayu sthanam. The same in the sharira we are able to elicit in the that sperm. Yes, we need to have a 100x magnification at least. If you are very good with your eyes, 40x magnification can also help in the microscope, but at least 100x magnification will be able to help. When you are preparing a slide, do not just rub the slide so much that the sperms are damaged and you are reporting something else which was not already in the patient. So a little bit of conscious lab skills are required. So though we know that everything in this world is made from Panchabhatik component. And Samhitas are saying that Shukra is a 4 Mahabhuta component dominant and Akasha is not there. But I am of a different opinion there. I will not say that Akasha is not there, but yes, I have my understanding of understanding that. See, I'll tell you these 5 components. Sushruta was a very literally Sushruta when he said Vayu Vibhajiti, Tejanam Pachati in the context of Garbha Nirmiti. And when I am able to see under the microscope, I can elicit that Vayu Vibhajati component in that Shukra whenever I am having the two-tailed defects, two head defects in the sperm. That Teja Enam Pachati, that Pachana, that coming from that Parinama Padyamananam to a Avyav component is very important. But when I'm seeing immature cells in the microscope and I'm able to see that that spermatozoa component is not able to develop into the that cellular component of that germ cell is not able to change itself, not develop itself into a motile sperm. There is some maturation defect is there, not the level of genetic maturation, no. But that the cell is immature in sense like it is not going to convert into a sperm. So that whenever we are able to see that immature sperms, yeah, we know that Tej Enam Pachati component is hampered. And whenever I am able to see agglutinations in the sample, agglutination means there is something which is binding all the sperms together, but the sperms are motile. It is something like we are trapped in a daldal. Daldal means teacher in Hindi we say. So we are able to move our limbs, but we are not able to come out. The same component is in the agglutination. The sperms are stuck in some inflammatory pathway thing. I'm not naming it anything, but the sperms cannot come out of that. They are motile, but they cannot come out of that. But Apo factor, that Kleda factor, is very much responsible for that achalatva in that sperms. So that head to head, head to tail to tail agglutinations, which are responsible for immunological factor infertility, very important, should be understood from Apaha Kledayati. Yes, next component, Akasham Vibardayati. See, this is the component what I am talking, that Akasha Vibardhati is such a component. If Akasha is not there, there will be no Vibardhana of that Shira, that head. And that pin head is nothing but the loss of that Akasha component. Yes, whenever we are seeing Pancha Mahabhut Anyanya Pravesh, we are able to see that as and when the Vayu is entering that process, there is loss of Akasha. But loss of Akasha is itself the understanding that Akasha was there, Akasha component is there. And in the end, Prithvi Samhanti, giving that compact form to the head, to that cells, to that tail, to that mid piece, is nothing but the Prithvi component. Malformed and well formed sperms can be understood on the level of this Panchabhauti composition. Vayu Vibhajiti Tejanam Pachti Apak Ledeti Akasham Vivarditi Prithvi Samhanti. But one more step we have to come down because we know a Tridoshik Siddhant we are having in Ayurveda, and Tridoshik Siddhant is nothing but the functional expression of those Pancha Mahabhuta. And based upon that, we are able to see Gunatmak Dushti also. So, if we are having a Samyak Panchamahabhuta, Tridosha, Vimshati Guna Siddhanta in the Sharira, if it is a Swastha Shira, Samadosha, Samadhatu, Sammalakriya, Samadhatu Surupin is there, some Avyava will be there. And if some Avyava is there, we will be able to see normal zoospermia, normal sperm, as is seen in the leftmost first picture where I have written the Samyak thing. If there is Laghu component, Laghatva is there, we are able to see that microcephaly, small headed sperms are there. Guru, Brahmanatva, big component, big heads. Adhapatana, they will not be able to move. There will be sthira, but there will be components of extracellular material, amorphous matter, cytoplasmic residues. Pichila, there will be, they will not be able to leave themselves in that seminal plasma. They will not be able to freely move. They will not be freely mobile. Pichila component, sthula, big heads, swollen heads, sukshma, those thin tails, thin midpiece, thin heads can also be taken into this thing. Ruksha, Shoshanatva will be there. That head Shoshanatva, mid-piece Shoshanatva, that component is not developing due to proper ahara, vihara, or anything component which is taking place in that spermatogenesis area. Ruksha, again, tailless, headless things. Hara, tapered. There will be much kind of friction in the process of spermatogenesis. There will not be any slukshanatva. Ease will not be there. There will be tapered kind of sperms. We are able to see the tapered heads, tapered tails, unnecessary coiling of the tails. It is very important to understand the doshik gunatmak principles there. And if it is manda, sthira guna is more, chalatva is less. They will be non-motile. It is just a primary thing what I am telling. It can be sthira plus rukshanatva. It will be non-motile, but it can be not be pin. It can be pin-headed. It can be pichila but sthira. It can be mrita. It can be guru but ruksha. There can be n number of possibilities when I am talking about the Vimshati gunas and Shukra dushtis. But when I am having a Tridosha dushti siddhanta, I am able to see Sammyakavat Pitta Kapha in the normal zoospermia conditions. Teratozoospermia, as I already tell. Terato means morphological defects. And Vayu is responsible. Vayu Vibhajati. Anything. See, Vatakala Kaliya mentioned this much big shloka for Vayu. See, this much big shloka for karmas of Vayu. Praneta cha manasaha, Indranam udyojakaha, Yantram tantra dharaha, Vayus yantram tantram. That is yantra and tantra is nothing but the sperm component which we are talking in the reproductive medicine. This defective pieces of sperms, heads, tails, mid pieces, nothing but the teratozoospermia, which is a vata dominant component. It can be samsarga in all the doshik components. I am not talking about that, but pradhanya rupena, it is vata component. Aspermia. See, one side the vayu is causing that anatomical defects in sperm. On the other side, it is causing rukshanatva, complete shoshanatva. There is no sperms only. There is no semen. Aspermia. Aspermia means no semen. Azoospermia means no sperm. Pitta, like Shukramargat Raktapitta, can also be taken into hemospermia component. Asthenospermia. Astheno means asthenozoospermia predominantly means a component where the motility is defected. Then motility component is given by the Vata dominant, but Vata Kapha component can be responsible for asthenozoospermia. Again, oligozoospermia. Their component of nutrition status is less. The seminal plasma is not good. The testicular volume is not good. Testes are not healthy. We can achieve a Vata Pitta dominant condition of oligozoospermia. That is, count is less. And on the other hand, we can also get pyospermia. That is kind of bacteria, pus, leukocytes, RBCs, anything can be amorphous matter can be seen in pyospermia component. So this is very good image I always show that how this Fenlam Tanu Ruksham component can be seen on Dosh level. See, Fenlam Tanu Ruksham. First component is, if you are able to see, there is some kind of a phenylata, and it is a good sample. Phenylata is there. Next is Tanu. It is not that much of thick. There will be a component of azoospermia or oligospermia. Next is Alpa. That is Ruksham. That is Soshanatva is there. Somanat Alpi Bhutaha. You will be able to see that components there. Next is Vivaranam Pouti Pichilam. In the first sample and in this sample, you will be able to see there is yellowish tinge. Yellowish tinge can be because of more abstinence, more than 7 days. It can be there because the febrile formation starts in the seminal vesicles, the vas deferens, and the epididymis where the sperm is getting matured. So after 7 or 8 days, it can be yellowish tinge. But in the Pichilam Anya Dhatuk system, you can see Anya Dhatuk system, there are immature cells, there are amorphous cells, there is Avasadi Guna. You can, in the last, that beaker, you can see. When we dropped that drop of semen into the water, it is coming as a streak. It should disperse like anything. It should disperse like this. But it is coming like a streak. It is Guruttva. Sthiratva is more. It is Avasadi. Avasadi is a component which is Snigdha plus Guru plus Thira, like this. So it is a combined combination where that semen will fall like this streak. So from that, we will be able to understand that Avasadi component is there. It is same like the Kshira Pariksha, what we do in the Matri Kshira, mother milk. So there is some immunological component into this also. See, this is not Mesospemia component, but it's a phenyl component, Shukra. So immunologically just works on two principles: down regulation, up regulation, and immunomodulation between them. Basic principle for immunomodulation. So the entire body is immune mediated system. Something is happening at the defense level mechanism, then only we are having a Dushti at the level of Shukra. So if it was a phenyl Shukra, we understood that due to Ruksha Lagu Khara Samanya Guna Siddhanta, it will be having a Vata Pradhanya Shukra Dushti. But when we did the upregulation from this downregulation to upregulation, I was able to understand that I have a Vishesha Siddhanta with me where I will be using Snigdha, Guru, Lakshana kind of thing, which will convert into my Chikitsa Upakrama, which is mentioned for me in the Shastra, Jivani Ghrita Anuvasan Vasti. See, one more example. This is a Tanu component. Tanu, Ruksha component is there. Yes, it is a Kshina Shukra Dushti. It can be a azoospermia. This sample was a azoospermia sample, what I am presenting. So in this condition, we need a Snigdha Madhura kind of component. And Chikitsa Upkrama, when I say from the Samhita, we are having Vajikarana Yogaha, Rasayana Prayogaha, Chavana Parasha Prayogaha. See this component. There is Vayu Vajati component where the Dhatu Rupena, Avyav Rupena, Shukra Dhatu Vikriti is there. And if that Shukra Dhatu is Vikriti due to Vayu, I know Tatra Ruksha Lagu Shitakhara component is hampered. And for the regulation, where I have to do that Vishesha Chikitsa Siddhanta, Chikitsa Upkrama, my Chikitsa Upkrama will go entire opposite to that Vata Pradhanya, and I will be doing same shloka which is mentioned Samhita. Sarpihi Payoho Rasaha Shali Yavagodhuma Shashtikaha Prashashtaha Shukra Doshishtu Basti Karma Visheshta. So these are guidelines. We have to understand it. See, we took Panchabhautik Siddhanta, we took Gunatmak Siddhanta, we took Tridosha Siddhanta. When we are coming to a component where Dosha, Dushya, Dhatu, immunology, upregulation, downregulation, Samanya Siddhanta, Mool Siddhanta of Padarth Vigyan, everything is coming together to understand the effects in the sperms. So I am presenting this Reto Pariksha entire report. If you people are with me, and you can see that in the middle line in red, I have mentioned one of the reports for your all. So you can take understanding how these things work. So I will be seeing just the parameter and the reference range, and you people just try to work on how the results are coming. See, abstinence should be 2 to 7 days, as per WHO 6th manual for semen analysis parameters is from that. Condition of the container should be sterile. Method of the collection can be masturbation, interruptus, coitus interruptus. Liquefaction time should be less than 60 minutes or equal to 60 minutes. Appearance should be opalescent. It should not be crystal white. It should be grayish white. Volume should be more than 1.5 ml. There is no upper range predominantly. pH should be equal to more than 7.2 to 7.8 something. Viscosity less than 2%, 2 centimeter or equal to 2 centimeter. Sperm count should be more than 15 ml. milliliter per ml. There is no upper count. Fructose should be present, and that avasadi and phenylta component should not be there. See, as a Vajikarana practitioner, I have all of Ayurveda parameters for these also to understand where these are fitting. That's why in the first hand only, I mentioned what is the normal thing, what is abnormal thing, and how the report is made. So these components are already present in my mind when I am reading that, oh, liquefaction is there. It is more than 60 minutes. Oh, it's a Granthi Bhuta kind of Shukra More of Kapha Guna is there. I have to go for Law Bhasma Prayoga. Fine. If sperm count is less, yeah, I know it's Kshina Shukra, it's Kshina Shukra, Nashta Shukra kind of component. Yes, there could be Vata Pradhanya, Shukra Dushti. I have to go for Madhura Aushadha Prayoga. See, there is a component of motility. 24% motility is there, but total motility should be more than 40%. Agglutination should not be there. Normality of the morphology should be more than 4%, but other morphologies defect can be there. Non-sperm pus cells could be there. Macrophages, epithelial cells, immature cells can be noted. Vitality is also noted when we are not able to see more than 40% of motile sperms, and if immobile are more, then we have to go for vitality also. Fructose test is very important if we are looking for a obstructive or non-obstructive kind of azoospermia. Amorphous matter should also be seen. So if you see this case, this is the case of oligospermia, which we understood on the level of Kshin Shukra and it was stated very well. Now, when we have come to this level, now I will give you a pinpoint fertility evaluation guideline, which will be practiced at every level. If you are practicing infertility, if you are practicing Vajikarana Tantra, if you are practicing sexual medicine, if you are practicing reproductive medicine. Primary, it should be systemic, it should be systematic, it should not be expeditious, it should be cost effective. ऐसा नहीं है कि we will be giving all kind of tests to the patient, all kind of investigations. No. It should target the most common cause predominantly, and it should evaluate both male and female in the first hand only. If woman is less than 35 years, you have a 1 year to evaluate. If woman is more than 35 years or equal, we have 6 months to evaluate. If woman is 40 years, 100% we should immediately intervene. And it is very important that woman is only the not cause. 20% of the infertility is due to male partner infertility. So male is also a contributing factor, very important factor. So male kind of infertility should also be taken care while dealing into the infertility evaluation. So first is the female infertility. We will just go through it. I believe that everyone is just coming with me, so that whenever I am just taking the thing out from that slide, it will just directly go, because the fundamentals we have understood very nicely. Yes. The first is female factor infertility. So let's start with this step 6 factor, female factor infertility algorithm. We have taken the history, we have taken the physical examination. Then we will be going for a ovulatory function assessment. What we do follicular monitoring. Starting from the second day of the cycle. Second day, we will send the patient for transvaginal ultrasound, and we will check if the ovary has deployed some eggs or not. And then from the 8th, 9th, 10th, 11th, 12th up to ovulation, we can go for the ovulatory assessments. Also, we have to go for ovarian reserve testing, either by AMH test, anti-mullerian hormone testing, which can be done any time of the cycle, anytime. It is a full body hormone. It is available anytime. It is not like morning mein hi karna hai, evening mein karna hai. It can be done anytime. AFC, antral follicular count, which should be done from 2nd to 4th day. Like I told, antral follicular count is nothing but how much eggs the ovary is deploying for the next cycle. If that is also good, we will go for uterine or tubal evaluation. We will see if the fallopian tubes or uterine cavity is good. There is no cornuate uterus, bicornuate uterus, endometrial thickness is good, something like that. Then we will go for, if that is also good, we will go for endometriosis assessment, peritoneal tears, peritoneal problems, also pelvic inflammatory diseases. We will be excluding that. And if everything is good, then only we will go for an endocrinal workup. Like we will be going for prolactin hormone, FSH, TSH. Yes, entire profile can be done. And then only we will be able to come at a diagnosis, proper diagnosis and treatment plan. These are evaluation parameters, not understanding parameters. Get it very clear. These are evaluation parameters. we are able to evaluate a patient that where the problem is lying. If ovulatory function is different, my treatment will be different. Uterine issues there, my treatment will be different. So key domains in the history comes from fertility history, menstrual history, gynecological history, some kind of contraception use karte hain, pills she is taking, anything we should ask from the patient. Obstetric history, if there is any recurrent abortion, previous abortion, live birth, how many child she is having, um, live births, how many times she has got pregnant, gestation, everything we have to evaluate. It is very important to rule out specifically in the secondary infertility management. Medical problems, autoimmune disorders, thyroid, diabetes, typhoid, TB, anything. Family history, if mother, masi, sister-in-law, all these kind of the relationship are having issue in conceiving, yes, there could be an issue of a genetic factor in the this female who is sitting in front of us. Social issues, if a female is having some tobacco, recreational drugs, BMI is also important. Obesity is a factor for this metabolic syndromes. We have an idea about that, and the same should be taken into the first step. Skin, if the patient is coming with dark skin, hirsutism, alopecia, acne, yes, some metabolic error is there. Thyroid should be evaluated. Per speculum, breast examination, per speculum examination for vaginal and cervical health should be taken into account. Bimanual examination for bulky uterus should be taken. And TVS is a gold standard evaluation parameter, which should be done at least for screening everything in a go from vagina to ovary. And there is some always a question ki if a female is unmarried, should we go for a transvaginal ultrasound? Yes, we can go for a transvaginal ultrasound. There is no issue. At least you should take it into a writing. It should not be a problem for us in the future. At least we should take it in writing, and we should advise the sonologist or the reproductive medicine specialist who is doing the ultrasound that I am requiring this. Would it be able through a per abdominal ultrasound, or we should go for a transvaginal? Take an opinion and just take a call. Then ovulatory function should be evaluated by the menstrual history. Luteal progesterone, that is progesterone P2 hormone, which is checked in the last week of cycle. That is 1 week prior to coming to the menstrual cycle, when we are able to see the entire 1 month of menstrual cycle, how the entire work was going on in the reproductive tract of a female. It is very important. Single hormone, luteal progesterone, will give adequate information about how the things were going on in the last 1 month. Then we can have a kits for ovulation prediction. There is some basal metabolic rate, high temperature rise, but sometimes females are not able to elicit that. So these evaluation parameters are very much necessary. Antimalarial hormone, AFC, basal FSH, and estradiol on the second day, they should be taken into account whenever we are testing for the ovarian reserves. And age is a very important component in female. With age, ovarian reserves fall. Women have come with a set of eggs, and out of those eggs, only nearly 400 will be deployed in the entire lifespan of women for menstruation. So wisely, timely, take a decision what you have to do as a Vajikarana Tantra specialist. Then for uterine assessment, go for a TVS, and then you can go for a sonohistography with saline infusion, histosalpingography. If nothing is coming out from that, we can go for a hysteroscopy, laparoscopy procedure. And if nothing is still evident, we can go for a 3D ultrasound. Like 3D ultrasound, we go for a T-shaped uterus, bicornuate uterus, torsions like that. And MRI of the pelvic area can be also done. Rule out everything of the uterine, ovarian, and adnexa pathology. To rule out that tubal patency, first line of treatment or evaluation is hysterosalpingo contrast sonography, HSG जिसको कहते हैं. HSG is a very it is coming with dyes with saline infusion, so it is not good to send a patient for HSG evaluation repeatedly. Go for once and then just evaluate the thing, how the things are going on. If tubal obstruction is confirmed, then we can go for a chromopertubation and some laparoscopic procedures. But what I have to tell is it is a choice of treatment, not the only treatment. That's why I have put a question mark in Uttarbasti at the end. Uttarbasti is such a component that at least I would say 80% of the cases we will be able to handle by Uttarbasti only. There can be tubal adhesions, hydrosalpinx like condition where this kind of things may be required, but it's may be required, not required, not always required. I'm saying. I will tell you a case. I have a case of a fallopian tube block also where we did Uttarpasti and we were able to achieve the patency of the tube also. We have hydrosalpinx, we are able to achieve the patency of the tube. Bas, इतना ही है कि in the primary stage we have to go for a systemic treatment and then we have to go for a sthanic treatment at the level of Uttarpasti. Yeah, Uttarpasti is a very important component when talking about the tubal patency assessment and evaluation. So get it very clear that laparoscopy, endometrial biopsy, post-coital tests, serum prolactin, progesterone, immunological testings for IgG, torch profile, CD4, CD8, CD4 should not be regularly done. Do not pressurize the patient to do unnecessary tests if your clinical skills are not that good. I am not in favor of like writing hundreds of tests and then coming to a clinical diagnosis. No. Your clinical diagnosis should be coming from a single luteal progesterone. Your clinical diagnosis should come from that FSH and estrogen profile. Your clinical diagnosis should come directly from that single transvaginal ultrasound. Our skills should be so precise. That's why the topic is precision reproductive medicine. And do not just go for ovarian reserve testing, always sending the patient for follicular count. Always each cycle patient is going for TVS. It's not good. And yes, you should know when and what the test should be given. And now when I come to male infertility, we know we have taken the history. We know we have repeated the semen analysis. And very important, my dear people, to confirm azoospermia, at least 2 to 5 semen analysis should be done at an interval of 15 days. Do not confirm azoospermia in the first sitting itself. There can be multiple factors which could be seen in the semen analysis. So at least go for 2 to 5 semen analysis at a stretch of 15 days. We need abstinence of 2 to 7 days. That's why. And do not start our medicine on the first day कि azoospermia है चलो आज से ही medicine शुरू करेंगे. No, it's not like that. If semen analysis is good, then a complete history, complete examination, genital examination is very important in male patients. Endocrine evaluation is very needed, very much needed. First, the FSH and testosterone will be a very good marker for you to check up the male infertility evaluation. If patient is coming to us with the infertility, it's male, yes, we can go for a FSH and testosterone combined profile. It will give us maximum of the things. And then rule out if it is azo, obstructive है, non-obstructive है, idiopathic है, oligo है, we have to rule out at each point. There should be a collection protocol predominantly to tell the patient to give semen sample at the lab only. If, for example, I am a Vajikarana Tantra specialist, I have a lab in my institution, we are telling the patient to collect the semen in our hospital only and give it through his hand only in the lab. We don't know who semen sample we are coming with, who semen sample the patient has brought from home. We know what is in that box. We never know. If we are processing that semen sample for IUI, you know whose child it would be. Unless we are not telling that patient the sample was of the patient. Get it very clear. There can be so many medical legal issues in the this practice. Reference value should be taken from WHO. Understanding should be taken from Ayurveda. Fertility threshold should be understood, motility, morphology, etc. Diagnosing of azoospermia should also be done specifically, like I told. And hormonal testing should be done if sperm concentration is less than 10 million. If there is a libido is decreased and other endocrinopathies is there, we should rule out some testosterone levels. Serum testosterone and FSH is a very good parameter. And if testosterone is very less, then only go for LH, prolactin, and TSH hormones. And in the lower part, if you will be having these slides with you only. So this is a component where the combinations are there, how the testosterone, FSH, and LH play their games, and how different pathologies can be understood by these three lab parameters only. Also, ultrasound for varicocele, prostate, etc. should be done if it is needed. Anti-sperm antibodies should be ruled out for immunological infertilities. If the patient is coming with the sample which is having a agglutination factor, sperm DNA fragmentation should be taken into account whenever there is recurrent abortion and miscarriages. And pyospermia can be understood if there is any infection, long-standing disease, long-standing infection, mumps, orchiditis, epididymitis, anything could be elicited from that. Again, I'm saying, evaluate here, understand in Ayurveda, treat with Ayurveda. It's very clear. Genetic profile is very important. Already I have told about azoospermic factors. If it is good, then no problem. If it is a problem, go with the karyotyping, go with the Y chromosome microdeletion analysis through PSR. If still you are facing an issue, go for a CFTR gene mutation testing. There could be a congenital absence of vas difference. There may not be a vas only from where the semen could be coming out. So in that condition, we have to go for a surgical uh, aspiration of the semen from the testis. TESA, PESE, MESA can be taken into account. And we have to tell the patient that, yes, you need help from the other system of medicine also. As a Vaidya, it's our utmost responsibility to guide the patients towards a right decision. It is not always me and my treatment. It is not always, and it is not ethical always. We know our limitations. We should know the possible outcomes also. We know our limitation. We should know the um, uh, possibilities also, where we should send the patients to have a child. If the patient is coming with a infertility of 14 to 15 years, you know what is the plight of that couple. They will cry anytime you ask them about the child. So in that condition, do not just go with trial and testing with the patient if you are not that much capable, not that much ready, not that much qualified, not that much um, empathetic, not that much in the um, mood of saving patients' time and money. If you have all those Vaidyavrittis, the today's age Vaidyavrittis, please go with the second option. It is not bad to have a reproductive medicine consultant on your phone. Just call him and ask you what can be done, and just send the patient. And if a conception is there, you help the patient to have a healthy conception for 9 months. What is wrong with that? So at the end, it is the core workup of the female, core workup of the male. If you want to have a screenshot, it is very important that just take a thing. Menstrual history, AMH, AFC, FSH E2, P2, P2, E4, transvaginal ultrasound for tubes, HSG, TSH for thyroid dysfunction, prolactin if problem is there, androgens if problem is there, histoscopy if we are not able to achieve anything, laparoscopy can also be done. Male factor, it is very important. More than one semen analysis should be done. Ejaculatory urine analysis is very important in retrograde ejaculation. If patient is coming with less than 1 ml of semen sample, rule out retrograde ejaculation. Maybe the semen is going back into the urethra to the bladder. And whenever the patient will pass out urine, the semen sample will become. So post-ejaculatory urine analysis should be done. If the problem is like that, FSH testosterone is good. Karyotyping for microdeletion, CFTR, and in then sperm DNA fragmentation can also be done. They are not routine tests. They are selective and based upon the choice and decision of the doctor only. So now we come to a point when we have understood everything about the precision reproductive medicine, the evaluation parameters where we have to intervene. Now we should see that is this all thing working or not? Are we just going to learn something and go out of this seminar today, or just we will be saying something ki yes, results hote hain. We are able to produce results. So first, I am presenting a case which is a very complex case in male reproductive system, that is OAT syndrome. But it is not OAT syndrome. In the next slide, you will see the diagnosis. It is a 29-year-old male IT professional from Bengaluru who came to the OPD for a preconceptional care with his partner. And they have a 3 years of married life, 1.5 years of trying period, and the sexual life is good. General examination is also good, but patient is having a history of smoking, 2 to 3, 4 cigarettes per day, and some kind of emotional disturbances and instabilities are there since work pressure is there, kind of that thing. So at the primary stage, we send the patient for Reto Pariksha. Reto Pariksha is a updated version of the WHO semen analysis parameter in the Ayurveda format. So on the right side, I have attached the Reto Pariksha report. See, sperm count is very bad. Motility is less than 40%. 6 plus 2 is not 40, it's 8. Pus cells is more than 20 to 30. It should be less than 5. Morphology is very bad. It is less than 2. And we should be having more than 4. The vitality was less than 56%. So see the case. It is oligo, astheno, tereto, pio, and necrozoospermia. What more complex we can get? Oligo, astheno, tereto, pio, necrozoospermia. Count is less, motility is less, morphology is bad, pus cells are there, infection is there, and dead sperms are there. So it was a WHO analysis, but for me as a Vaidya, it was a Kshin Shukra Dhatu Dushti with Anya Dhatu Samsrishta Shukra Dushti. See, in the left side, you will be able to see the semen analysis lab, that microscope image also. As and when we will progress, just try to see that image and how the things are changing. Then we went for a Shatabrigit Snehapana. It's Uttama Punsmaneshu, it's told in the shloka. Then Vishram Kal, same thing. Virechan with the Gandharv Ki Churna. We were able to achieve 8 Vegas, 10 Vegas, Sansatikam for 5 days, and then just we started with this Adizoa. It's a proprietary medicine which is having a Shugandhas, Saved mostly, and other things are spermatogenic drugs. Amlaki Rasayan, which is the Bhavita Amlaki Churna, and Rasna Irandadi Kashaya. It's Rasna Irandadi Kashaya is predominantly for the Avyava Dushti, Marmasi Sandhigata Dushti, Dhatwashi Dushti, and predominantly in the last line, some Pradathapna Konsavana Karma is also mentioned in that. So Rasna Irandadi Kashaya is also kind of a Pachaniya Kashaya. It is kind of a Brahmana Kashaya still. So we gave this for at least 2 months. And in between, patient was suffering from some mild epigastric pain and fissure. And we just went for a shell opinion. There they gave their usual treatments, and we just stopped the Amlaki June for 15 days. And after nearly 1 month, we repeated Reto Pariksha again. Yes, nearly after 1 month, we repeated the Reto Pariksha again, 1.5 months nearly. Now see, there was an improvement in count, there was improvement in motility. 32 plus 10 is equal to 42. See, morphology went to 2 to 47. Fine. But still, the patient was of moderate oligospermia with pyospermia. See the count in the left image. This is round image. But still, my diagnosis, Kshini Shukra Dushti with Anya Dhatu Samprishta Shukra. Now we gave the patient internal medicines like Shiva Gotika, Chavan Prasham, Suksham Trifla is Trifla plus Kajali. Puranavadi Kashaya for Shotha, Jwara kind of spectrum, those Dushti spectrum. Tarunya Karachikitsa we need. So we went for Puranavadi Kashaya, and that is was continued. Then we went for from September in the next in November we went for again this Reto Pariksha. We went from such a big spectrum of Shukra Dushti to see just agglutination and pyospermia kind of 14 sperms. This pus cells, 15 to 20 pus cells were there. So we were able to elicit pyospermia, but in my understanding, it was just a Puereto Dushti with predominantly the Pitta Dushti was there, kind of Pitta Kapha Dushti. Then we started with Gandhaka Rasayana, Puranavadi, Chavana Prasham, and in February we were able to achieve Prashasta Shukra. See the right-sided image of the semen under microscope. So this is the primary result. Secondary result I'll show. See, in the March patient missed the LMP, and in May we were able to achieve beta HCG level more than 10,000, confirming the Garbha Sthiti, that is a gestation, and single intrauterine gestation age of 6 weeks 1 day. That is not a big deal. The big deal is from right side where the changes in semen can be noted very well. What is first, what is second, what is third? You will be able to elicit very easily how the things are happening. So what is this? See this shloka from Charaka. Vajikarana yoga hi prayog. When? Dushtam yada bhavesh shukram. What to use? Ghritam jivaniyam. We use Shatalji Chavan Prasham. We use Chavan Prasha. Giridasya prayogaha. We use Shilajatu. Reto doshanam. Abhya amlekiyam. We use Abhya amlekiya Trifla Rasayana. We use Trifla Rasayanam. Annadhatu Samsrishtam Shukram Tad Viksha Yuktitaha. Yuktitaha we use Rasa Irandadi and Puranavadi Kashaya. So it is not the short formulations that are going to work. It is the yukti that is going to work in the patient. Even that water can be given as a medicine, and even that water can be given as a visha. So this is the primary case where we were able to achieve this change from 8 to 3.63, 20 to Prashasta Shukra. And within a span of nearly 9 months, we were able to give a patient a healthy baby. In such a complex condition, see, OAT, Pio, Oligo, Necrozoospermia. This is the one case. Next is second case of azoospermia. It's a 30-year male patient who was trying to uh, have a conception with his wife. Wife profile was normal, and he has shown in some modern hospital from where he got no results since the last 7 months. He was having some generalized weakness and decreased body strength kind of feeling also. Libido was proper, ejaculation was proper. There was no issue in the sexual profile, and wife's profile was also normal. So we took the Dushti as Shukra Dushti and Nashi Shukra because in the semen we were able to find not even a single sperm, even on centrifugation. On repeated samples, we were not able to find semen analysis, and already patient was having 2 to 3 reported azoospermia reports. So it is unnecessary to repeat a sample. We should intervene immediately. So patient came with the complaints. This, then we went for a analysis. We diagnosed it as azoospermia, predominantly non-obstructive azoospermia because there was seminal plasma was present. We just went with some normal formulations of Marmanthrasa, Pushpadhanva, Makardhwaj, Purnachandrodaya, Makardhwaja, Swarnavanga combination, which was mixed with some Kapikachu churna and was given with milk to the patient. And there is one this proprietary medicine, Shilatone with the Shilajatu. It was also given to the patient. And see, before and after you will be able to see the results. Sperm count nil. Nil means 0 million per ml, no sperm. We were able to achieve 20 million in just a matter of 3 months, 11, 12, and 1. November to January, we were able to achieve this. And I have to quote here that normal spermatogenesis process takes 72 days. So at 45 days stretch, we can repeat a semen analysis, but it is good to repeat the semen analysis at a stretch of 60 to 70 days when a complete one cycle of spermatogenesis or new sperms have been deployed in the testis. Next is also a very good case of torch syndrome. It is a female, 27-year-old female who came with the secondary infertility. She already had a 4 to 5 years of one child, and she was suffering from 2 spontaneous abortions. And her immunological profile, which is a torch profile, showed raised IgG levels, and cytomegalovirus was issue there. So she was having 2 spontaneous abortions. 6 months she had already tried, but she failed. That's why she came to our department for the management. So menstrual history was kind of a normal. She was already under some treatment at other hospitals. Some supplements were going on and other things. Follicular scan showed normal morphology, and follicles were developing nicely. Since on the 14, 15 days, we could be able to see the free fluid in the pouch of Douglas. So it was possibility that ovulation is happening. But still, if 2 spontaneous abortion is there, there is some systemic dushti in the sharira. And based upon the lines of some systemic dushti, we were able to elicit as a presentation is Vandhyatva, but predominantly Vata Pitta kind of Vandhyatva leading to Prasravana, Garbha Patati, that kind of a dushti is seen. And on the lines of Jwara Chikitsa only, we planned this treatment with Vaishamya kind of Agni and Sangha kind of Srotarodha in the Garbhashaya and the Sharira. So it was a secondary infertility. We just went with a simple protocol. See, Sneh Panavi Tikta Greta, Vata Pitta kind of Shamana and Shodhana kind of drug. Virechana with Trivrita Trivrita is Leshma Pitta Prashamanam predominantly. Virechana Karma and Shrota Shodhana was achieved. Then in the primary setting, we went with the Arogyavardhani and Dashmalo Kashaya as a treatment, basic treatment. And in the later stage, we went for Kalyana Grita, Vasanta Kusumakar as a Rasayana Prayoga, and Garbhapala Rasa to maintain that Garbha Sthiti in the Sharira. Garbhapala Rasa is, it is said in the shloka that we can give it from stretch of 9 months. Entire 9 months we can give. There is a this practice by in Maharashtra and other states. I have also seen this from Dr. Sujata Kadam madam, who is dean in IR right now. She is also practicing the same thing, Garbhapal Rasa for 9 months, and advocating the same for Ayurveda practitioners. But there are some issues with the Anupana concepts. So proper Anupanas like Draksha Jala, Draksha Hima should be given with Garbhapal Rasa to maintain the efficacy to come up with better outcomes predominantly. We were able to achieve conception within 2 months, and the baby was delivered. And what is very astonishing for us is that maybe the torch infection should travel from mother to child, but maybe I'm not saying definitely, but when we went for the immunological profile of the child, the baby was torch negative, and it is a very big um, outcome for us. Still, mother's IgG level were mildly raised. In the repeated torch profile also, the IgG level was raised in the mother. It is showing us that there is something seated in the body since long. IgG is the longest standing antibody in the body. है ना? And if something is happening in the body for a long time, IgG will be maintained to maintain that homeostasis of the defense mechanism in the body. And for that, IgG is there. Maybe that antibody is not crossing the placental barrier, and it is not going to the baby. But we were able to achieve a healthy baby boy with a torch negative profile. So this key takeaway from this is that modern investigation is just helping me, but my integrative decision is not based upon the modern parameters. It is just to evaluate what is in the patient. My understanding is Ayurvedic, my diagnosis is Ayurvedic, and my treatment is Ayurveda. And I am able to give the results based upon the Ayurveda only. See, this case of a fallopian tube block, what I was talking earlier. So patient had a 2 years of primary infertility. They were married since 2 years and trying to have a child. Though she was having scanty menstrual cycles, and there was a kind of weight gain and hirsutism. So we went for USG and TVS. So followed by HSG. So we were able to achieve a bilateral polycystic ovarian in the patient. Head nexa was nearly normal, but on HSG there was left-sided coronal block. That is, fallopian tube block was there because no peritoneal spill was noted in the HSG X-ray film. So my diagnosis was Uchit Patha Avarodha. Ashapa has mentioned Uchit Patha Avarodha. Uchit Patha. Uchit Patha is the patha from where the shonit is coming out of the sharira. Uchit Patha. That fallopian tube is Uchit Patha. That vast difference is Uchit Patha. Everything is Uchit Patha where the physiology should happen. So Vandhatva due to Artava Sotorodha, Kaphavat kind of a vitiation can be understood. And since the Artav Dushti, the systemic pathologies they are going on is of the Stimita Ashaya. So 100% we have to take the consideration of like that. And when we went for Chikitsa, we went with the primary Niru Vasti protocol for 2 to 3 days, followed by Uttar Vasti. We went with Dashamula Taila Uttar Vasti for 3 sittings, consecutive 3 sittings from the day of cessation of menses, 5 to 10 ml, at least 5 to 8 ml, we are easily able to instill in the uterus. More, there can be issues, but using a IUI cannula in today's era, with the sterilized oil, sterilized procedures, Utpavasti can be a game changer in such conditions. Internally, we went for Dashmul Kashaya, Samam Pachanartha condition, Shardharana, this tablets, and some Kumaryasa for three Prakriti Samyam. And also, we have to maintain that PCOD condition. So, yes, Dashmul Kashayam, Shardharana, and Kumaryasa was working on that line, and it was also treating the fallopian tube issues. And within the 3 months of this Uttarvasti, we were able to achieve what we are seeing on the screen. See, first scan is before, where there is, I have shown that arrow. It is a left-sided tubal block. And left fallopian tube is not demonstrating the free peritoneal fluid. It is mentioned like this here. And the after images, see, both tubes are nicely well open. So when I talked about the tubal patency problem diagnosed, we have an option. We have a treatment solution. And it is a validated treatment procedure. It's a reliable. Multiple times I can produce the same results. Not 100 times, but multiple times I can produce the same results. And we are doing it on the clinical daily basis in our OPDs. So yes, it is pan India presence of Uttar is there, like for this procedure. So it is very good. And one more thing of Uttar in male also I will talk here. We had a patient of a torch positive male patient in whom we were trying since many days for internal chikitsa with Basti Prayoga, Niru and Anuvasan Basti Prayoga, and other chikitsa also. We went with a Uttar Basti with Guglu Tiktaka Ghita in that patient. And within the span of 4 to 5 months, the patient conceived for the first time. It is very important that patient conceived. But there is also an issue. In some time, we also have an issue. And as a vigilant Vaidya who is specializing in this field, I know my lacunae. So I will clearly mention that. There was no heartbeat up to 6 weeks also. We had a patient on wait and watch policy. The patient has not returned to the OPD again. But when the patient came last time, there was no heartbeat at the 6th week also. But first thing, we were able to achieve conception. See, but there is some issue with the heartbeat. So I have to check myself where I am going wrong and what more I should do with that patient. This is one more interesting case of hyperprolactinemia with thyroid antibodies. So it is a female of 24-year-old, persistent amenorrhea 6 months, and the patient is a known case of hypothyroidism and autoimmune thyroiditis with some feverish kind of thing, general debility, and patient had a history of hypothyroidism and autoimmune thyroiditis in mother. It is there, and she's also on medication. The same is transferred to the child, that girl. There was issues with the amenorrhea. She went for investigation, per abdomen USG that shows nothing. It was all good, but endometrial lining was a kind of 4 on the 28th and 29th day also, if we calculate for that cycle. But she was amenorrheic since 6 months. And laboratory profile, then we went for anti-TPO. So before I go to anti-TPO, what I did is this. I just planned a basic treatment of Hingu Bachadi for 5 days, first 5 days. Then I went for Hingu Bachadi with Mani Guda for next 5 days. And after that, 10 days, when I was able to achieve Kosha Shuddhi, Agni Dipti, and Ampachana in the Sharira, I went for just Dashmul Rasnadi Kashaya, Hingu Bachadi Gulika, and Thyrocam, which is a proprietary medicine from Vajikarana. And for this thing, for amenorrhea, for thyroid, everything, I just planned this treatment. And I also went with the Karpuradi Taila, with chukku powder, that ginger powder, Udkarshana at the thyroid. This is what we learned way back before in Marma Chikitsa from teachers from Kerala, Shivat sir and other people. There they do this Chuntri Churna Udghashana in the thyroid region for thyroid issues, hypothyroidism predominantly, along with Takradhara also in the thyroid region. So we tried that also in this patient. There was some kind of patya following, but to our result, the result should speak more than our medicines. So that anti-TPO went from 243 to 138. It is a positive. It should not be more than 9. I'm not saying I was able to give a complete result. No, that is not my intent of presenting this case here. That went from 243 to 138. But see the prolactin levels. On 23rd September, since prolactin mimics the hypothyroid hormone TSH, and TSH and prolactin are bhai. If one is more, the other will be more, and they will be landing into amenorrhea. So when I went for this prolactin level on 23rd September in 24, the prolactin level of 41.97. It should not be more than 20. It is 2 times increased level. And the patient, if it is a hypothyroidism patient, it is anti-TPO positive autoimmune thyroiditis with such a great level of increased prolactin level, there should be amenorrhea. Because amenorrhea was persisting since last 6 months. So that amenorrhea should have persisted for next 6 months also. If the body is coming to normal with those medicines, there should not be amenorrhea. And yes, after 50 days of management on 20 August 2024, patient had menstruation with 5 pads per day for 5 days. And see, in September, still the prolactin level was high. That is something what Ayurveda talks about. If in September the prolactin level was high, then anti-TPO level was high, thyroid is very much deranged, there should be persistent amenorrhea. But our medicines, on what spectrum we have given, they are working, and they are giving a result out of that at the level of Artavadushti. And there is a line what I have taken from a book which is called as a compassionate healer. And this is this book, Compassionate Healer. If you can see, it's coming from Kotakal Ayurveda Shala. There's one line mentioned by one writer in this book that Ayurveda may not correct your lab values and pathologies, but it will correct your presentation or the Abhyantar Vikriti. It is not always possible that we will be able to give 100% result in the IVDP of the patient at L4, L5, S1 level. but the patient will be having a good range of motion. Patient will be happy to walk. Patient will be devoid of pain. So yes, there are situations when the lab reports are not saying the thing, but Abhyantar Vikriti Parampara is changing and we can get some results in those things also. And then I came to the last case, which is a very important case of Y chromosome microdeletion, what I was talking earlier. It is a patient profile, male and female, 33 and 34 years. Female is housewife, primary infertility. They have not conceived yet, and regular cycles. She is a case of hypothyroidism since last 6 months, and on thyroxine 50 mcg already taking. She is kind of obese, and some kind of polycystic ovarian pattern is seen in the ovary also. In males, uh, she's an engineer living in Pune, primary infertility, no smoking, no alcohol, nothing is noted. There was a COVID infection after which he recovered in 12 days. There is decreased libido after COVID infection, but testes on examination are bilaterally soft. The contour is lost. They are non-tender, but contour is lost. That no issue is noted in the profile. But on semen analysis, no spermatozoa seen in the pellet. On repeated semen analysis, multiple times azoospermia is noted in the patient. Then the next step is karyotyping. See, semen analysis done 10 times. Microtested done, sperms were extracted from the testis. No sperm seen in the lab. Scrotal Doppler showed mild varicocele. But see the last point. Y chromosome microdeletion at AZFC region. There is no maturation of the sperms. Testosterone level is less. But prostate and other things, transrectal ultrasonography is good. And the female factor C, nearly there is no such an issue, but still there was polycystic ovarian pathology. But in this case, my entire focus is on this. The left side I am pointing. AZFC region is deleted. It's not there on the gene, on the chromosome. So the patient was already taking treatment at a very big reputed institution in India. It is a very big reputed institution. I'm not taking name, but it's a very big institution in Pune and Hyderabad. So patient took medicine, but patient came to us. Maybe we will be able to see some results in Ayurveda. We started Ayurveda treatments. We started Anta and Vajikarana Chikitsa for nearly 3 to 4 sittings. We did Niruha, Anuvasana, Uttar. Myself, I only did the things. We did Rasayana, Vajikarana protocols, everything we tried. Patient was very compliant. He did everything what we told. We did other things also, like um, there could be some dosha in the family, in Kundali. We tried to evaluate that also, but still, till date we had no improvement noted. So I am not saying that it is a limitation of the Shastra here. Maybe we are not capable right now, or we have not studied right now like that, and we have not thought in that process that we would be able to achieve that microdeletion status into a normalcy. I'm not quoting it from my end only. Um, nor I am generalizing the statement that it would not be happening anywhere in the world. It may be happening. Even the Ayurveda doctors could be taking the lead into this thing. But as of now, I am a um, newer person only. But still, whenever we have seen this relation, we are not able to give that much of results. And there comes the role of a Maitrikardam Art issue. We should genetically counsel the patient. We can help the patient to get a donor sperm through right channels. We can help the patient to get a ICSI done or IVF done if issue is like that. And if they are longing for last so many years, the right decision is the right decision. It is not Ayurveda or a modern thing. I find it like that. So when we have understood this, I will just give a therapeutic snapshot on the things so that you can take something with you from today's analysis of this so many things. Like if there is Vata Dushti, just go for some Vrishyavasti, Yapnavasti, Kshiravasti, Mamsrasa Prayoga, Utravasti. It is just from Shastra only. Pitta Reto Dushti, just go for some Virechana Karma, Tikta Kshiravastis, Utravastis. If Kafaja, Ati Pichila, Ati Guru, Granthibhut Shukra Dushti says seen, go for some Vamana procedures, some Kledhara Dushtis, some Prameha kind of line of treatment, some Kushta line of treatment can be taken into account. Prashasta Shukra is the complete motive of this Vajikarana Tantra. And if translating into some modern terminologies, if you are seeing oligospermia, Shukra Janaka Dravyas can be helpful. Shatavari, Mushli, Ashwagandha, Mahamashtel, Uttarbasti, Balashwagandha can be given. Asthenospermia, where the motility issues are there. Virechana Karma gives very good effect because of controlling the systemic Vayu control and at the level of Pakwashaya Gata level, which is the Ashaya of the Shukra and Shukravasiras. Virechana Karma, Basti, Uttar Basti can also be given internally. Pipali, Shunthi, Amlaki, Makarbhaja, etc. can also be given. Teratospermia, where the varicocele is one of the important component. If someone is ruling out 1 and 2 grade varicocele clinically, I don't want to comment on that, but at least you cannot clinically find grade 1 and grade 2 varicocele. Even on Valsalva maneuver, progressed grade 2 varicocele will be seen, and you have to go for a ultrasound to reveal that. I'm not telling it cannot be managed. Yes, it can be managed to very extent in Ayurveda also, but if it has gone beyond concept, Shastra Karma can be options. Refer to Vaishali Tantra department specialist. Virechana, Mahakalyana Grita, Falagrita, Amlaki, Guduchi can be given to reduce that oxidative stress at the level of testis, that Andashe, that Ritovasira, and also to produce a nice good sperms. If azoospermia is there and if obstructive kind of thing is there, primary situation. Rule out if it is azo, obstructive and non-obstructive. Then only go for something. It can give results, but it may not give results also. Shukra Pravartaka Pramathi Dravyas Vamana Virechana can be given. This Harityadi Yoga is taken from one of our teachers. He is practicing this, but we have literally not practiced this into our practice. And so, what about the results? I'm not talking about anything. Vrishavastis can also be given, like Balashwagandhadi, Kshirbala 101 can also be given, and they may also give some positive outcome in such conditions. There is this Hindu Tika which is mentioning Retamsi Abhijani Bhavati. Reta says semen. Abhijani Bhavati. There will be no sperms. Praja utpadne na smartha bhavanti. You will be getting that semen component, but there will be no sperms. So in that condition, you have to rule out the azoospermia component, both obstructive and non-obstructive azoospermia. At what level that azoospermia is manifesting, you have to rule out that. So get it very clear. All things are very much manageable, but until unless you don't know the protocol for obstructive and non-obstructive, it is of no use predominantly. For obstructive, there is retrieval of the sperm from testis. Fine. It could be PESA, PESA, or MESA. You can use anything, followed by IVF or ICSI. If, for example, there is no vast difference, how you will be able to help the patient? Surgically, we can retrieve the semen, sperms predominantly. Cryopreservation can be done, and then it can be given to the patient through IVF. And later, to maintain that potency of that Stree Shonit Garbha and Garbhashya, we can treat that Stree Shukra like that. We can treat that Purusha Shukra like that. But the fertilization can be lab lab based, like IVF kind of thing. For non-obstructive azoospermia, genetic counseling is very important. If after at all everything you are not getting results, genetic counseling is important. You should help the patient to take up some step to go for a donor sperm kind of thing. Yes, if donor is known, it should not be known predominantly. It is coming from a sperm bank. But if it is donor is known, go with a Shavana Shodhana kind of line for the donor also, get a very good sperm and get it fertilized. Varicocelectomy, if it is a grade 3 or very progressed pain, strangulation, tissue death in the testis is going to happen, don't wait for anything, go for a Shastra Karma. And other things like adoption is a very good thing. So many children are waiting to be taken into the families. So adoption is also a good thing. And sometimes we have seen like there are some stress factors, mental, psychological factors where the parents are taking first child as a adopted one and the second child due to Saumanasya Garbhadharanam, their life becomes so happy that the second child is conceived very easily. So that Mansik factor where the Vagbhata Acharya has said, Alpa Saptwasya tu kleshe hi Bhadyamanasya Raginaha. We are very, as a Vaidya, we have to take Manu Dahika Prakriti into account and Sampraharshanam, Dehasya Ujaskaram, Saumanasya Garbhadharanam, Manusho Harshanam kind of treatment should also be included based on the Vajikan treatment. And when I'm saying this, it is very categorically mentioned in Jwara Chikitsa Manasya abhite purvam vatadyahi dushyati. If mana is dushita, vata pitta kapha will do dushana of the dhatu, reto vasira, etc. If dehi hi dushyati, mano abhite hi api dushyati. If deha is not that good, mana can also be involved. Like sexual performance anxiety can be there on manohabit lakshanas. Erectile dysfunction can be in manohabit lakshanas, but premature ejaculation, dyspareunia, ED can also be seen as dehabit lakshanas and manohabit lakshanas. So it is very important to rule out both as a Vaidya. So coming to the last part of the today's session, how is teaching and training of this Vajikarana Tantra specialty going on in India? So this is the Gazette of India by NCSM Regulation 2024. So this is predominantly the MD course in Rasayana and Vajikarana, which is Rejuvenating and Reproductive Medicine in Ayurveda, as per the new Gazette of 2024 NCSM guidelines. Earlier, this teaching and training was conducted under the Department of Kaya Chikitsa. Kaya Chikitsa is the mother branch under which three domains are flourishing. That is Kaya Chikitsa Samanya, Rasayana evam Vajikarana, and Manas Roga and Manovigyana. But since the new Gazette has formed and new um, departments specifically have been created by NCSM for that. That is MD Rasayana and Vajikarana will be the degree which will be known as Rejuvenative and Reproductive Medicine in Ayurveda, where both the rejuvenative, that is Rasayana component, and the reproductive medicine of the Vajikarana component are taken into account, and the curriculum is framed like that only. And the specialist is known as Ayurveda specialist in the department of, in the domain of rejuvenative and reproductive medicine in Ayurveda. So these are some things which are not known because I myself, when I'm coming from such a department, I know that how many people are opting for this department and how many people are coming to the department. Choices are very limited. I'm not talking about that, the choices are very limited. But lack of sensitization, lack of awareness, lack of knowledge about this thing is also very much important, that people are not making a choice. Still, they are going for this infertility management after pursuing Dravyaguna, after pursuing Rashastra, after pursuing Kachiksa. If they are pursuing this thing and they had this into the mind, they already had an option of MD Rasayan and Vajikarana into their mind if they wanted to go for a infertility management practice in their coming futures. So what we specifically do in the field of Vajikarana, manage infertilities, sexual dysfunctions, susantanata, the entire thing what we discussed. Rasayana and health promotions through multiple things like cancers, immunological factors, immunological infertilities, immunological vyadhis, chronic disorders, and number of diseases. On laboratory investigations also, CASA, cervical mucus, postcoital, etc. we can do. As a Rasayana Vajikarana specialist, we are authorized to sign and give the semen analysis reports. These reportings also, other people may not be able to give that if it is not a standard laboratory. I have to myself sign that report and diagnose based upon that Ayurveda parameters also. It is not like I am giving a semen analysis report. So post-graduation Rasayana Vajikarana shall be a specialist in rejuvenating and reproductive medicine. So these are some domains of research also where we people, especially those who have come here to listen to this session, Vajikarana Bhavas, some tests, collaboration with Susantanta, with Stri and Prasuti Roga specialists, infertilities, sexual dysfunctions, Vajikarana drugs and formulation, newer age Vajikarana dosage forms, Pradasthapana drugs, in vitro fertilization, assistance in Vajikarana. We have seen if Vajikarana treatment is given before, the chances of IVF, which are only 14%, can be improved up to 30 to 35%. Some collaboration with Panchakarma and other departments, some IUI, intrauterine inseminations, like this newer age technologies which are incorporated with Ayurveda can also be done. Rasayana Vajikarana, what I told today is not predominantly taught in the UG curriculum of Ayurveda. Even in the PG curriculum of Ayurveda, this only specialty has these things. So yes, interdepartmental collaborations can be achieved from that. And for the upcoming DM Ayurveda programs in epigenetics and reproductive medicine, MD Rasayana Vajikarana will be taking this degree more further to Vajikarana spectrum. So this is the institution from where I am coming, that is KLE Shri PM Kankanwadi Ayurveda Mahavidyalaya, where this is the only institution in India where the MD Rasayana Vajikarana specialty is going on since 2015. It's 11 years now. And earlier it was in the Kaya Chikitsa department. We are still a sister concern of Kaya Chikitsa, but as a separate department, we are working as Rasayana and Vajikarana. It is a center counseling subject, will be given by AACCC only. NCSM guidelines. and the intake is 6 only. Entire India, complete India, all postgraduate colleges, there are only 6 intake for Rasayana Vajikarana specialty, and that is in this institution only. You can take a PhD as a Vajikarana subject at all institutions like AYA, ITRA, Jamnagar, uh, KLE also, all national institutes where the PhD is going on. But for the post graduation, this is the only resort for MD Rasayan and Vajikarana. So, as someone who is working in the domain, there are some recommendations, genuine recommendations. Number one, time to conception increase with age. The American Society for Reproductive Medicine says the best time to conceive is between the 3 months of your marriage, first 3 months. After that, that fecundability period delays. There's the chances of getting pregnant delays. The first 3 months after getting the marriage. So get married at a right time, plan a baby at a right time, and do not just um, keep on delaying if you don't want a baby. If you don't want a baby, you don't want a baby. But if you want a child, you want a child, and you should take up a decision that I will be making that child disease free, anomalies free. After 30 or 35 years, the child born could have a Down syndrome, could have genetical abnormalities. You can see at the stress level what we are facing. You can see the metabolic stress what we are facing. You know the reactive oxidating species which are destroying the sperm components, DNA fragmentation, etc. So it is not a question ki someday we will have sex and someday we will have a baby. No, if you want a conscious child to have with you, you should take a conscious decision to conceive at a right time. Number one. For women, 35 is the right upper limit. After 35, please take a decision at the earliest. Menstrual cycle should be normalized for female predominantly to maximize that fecundability window. Smoking, alcohol is not good at any cost. Women, men, anyone. Healthy lifestyle and diet share should be encouraged. Exercise should be encouraged for men and women both. And reproductive age, men, women should be encouraged to extent possible to limit their exposure to endocrine disrupting chemicals. Those lotions on the skin, those perfumes, those hair serums, those sprays, those caffeinated drinks, those artificial sweeteners, everything is endocrine disrupting chemical in today's age. You never know, your lab profile is not showing you the correct thing always. There is something going in the body, air, water, everything is in the state of Janapada Dhwansa. And the Janapada Dhwansa, if it has manifested, the only resort is Rasayana. Mentioned by Acharya Charaka clearly. Rasayana, collect that and use that for yourself to get a healthy life. And to conclude, see this, whenever I am presenting anything at any place and I have a conscious audience to listen to me, I always paste this left-sided image for you people. What when you and your someone in your family falls ill, what is the first choice of treatment? See Ayurveda, it's 62.6%. So already the society is looking us for hope. But on the right side, how to choose the right doctor is a very good option. Take yourself in the shoes of patient. Do not just think Atmanaha Putra Bandhavanapi. It is categorically mentioned. Look for a right specialist. Look for a right doctor who is well versed, well learned, who knows what to do, when to do, how to do. Medicine is a specialized domain of protecting life, enhancing life, and getting some better outcomes. So, if you want a better baby on a board, take a better doctor. It can be anyone. I myself have learned from so many people across the nation. I have nearly 100 plus teachers who have given me at some point, some or other thing which I can take together to help a patient. Doctor should be learned. Doctor should know how to do. And to become a Vaidya Vritti should be there. Maitri Karunya Marteshu. You should know how to deal with a patient who is suffering from such a plight in his mind and body for having that a single child. Then it does not matter if it is a boy, it is a girl, it is just a child that the family is wanting to have. So in that condition, I am leaving you with this slide. Just 5 words from sperm and 4 words from ovum. Sperm. put it in your clinics, put it in your mind, and just treat easily. It's a very easy branch, algorithm-based branch. It's a mathematics that we have to do. Stress control. Stress is a very big factor. Stress, mental stress, emotional stress, physiological stress, sociological stress, psychological stress, societal stress. You can know the societal stress, emotional stress on a wife who is not having a child from that husband, from mother-in-law, father-in-law, family, anyone coming in the market on road. Why you are not having a child? The question mark. They will not be understanding what is PCOD. And now it has been converted to PMOS. The half of the population is not going to understand what PMOS is. So stress control is very much important. Poisons. Reduce the poisons, alcohol, tobacco, caffeine, sugars, etc. 3. Exercise should be induced in the Sharira. You should do exercise. Laghavam karma samarthi. That karma samarthya of the Sharira can also be taken into account from this thing. Reduce heat. That heat is very much responsible for that oxidative stress in the testicular regions. Wear loose, kind of loose undergarments. If varicocele, hydrocele is developing, check your doctor. If some kind of undo, kotha, skin eruptions are there on the testicular area, vaginal area, go to a doctor. Mediterranean diet. Mediterranean diet predominantly refers to these shark, phal, nuts, fats like this. But ati shaka is also not good. Shakaha raktam pradoshayati, harit shakaha. So rakta drushti cannot be happening in the body. So limited, everything is done. So sperm, these 5 should be taken into account. Ovum, to maintain that good ovum health, optimal and timely period should be maintained. If you are having oligomenorrhea, amenorrhea, refer to a doctor, go to a doctor. He will help you out. Vital nutrition. Nutrition is very much important for females. If they are skipping the meals, they are still nutrition deprived. If they are unnecessary eating, they are still nutrition deprived. If they are taking junk or other things, still they are nutrition deprived. Malnutrition can be both plus or minus. It is malnutrition only. Unhealthy habits to be avoided. Same. Tobacco, alcohol, sweets, artificial sweeteners, trans fats, junk foods, etc. should be avoided. Maintain a healthy weight and mind. Very important. Like I say, uh, male body is muscles and bones, but female body is hormones. Okay? Male body is muscles and bones, but female body is hormones. This hormone is such a component in female body. It can be triggered by just a simple pinch, simple word, simple food, simple triggering element. So maintaining that healthy weight and mind. Weight means entire body. So these 4 ovum words, so that we can go from I infertile, I am not fertile, to I am fertile. See, it's a very simple objective that we are going to reach from this Vajikarana Tantra, this marathon lecture, what we did right now. I am fertile to I am fertile. So, as I conclude my words, I sincerely express my gratitude to the only and only institution of post-graduation in the science of Vajikarana, that is clearly our world. The head of the institution, Dr. Suhas Kumar Shetty sir, who is always there to help us for doing such great initiatives to come to such kind of platforms to share our views. And also SITARAM Ayurveda, which is my learning place also. My teachers are there, J. Manathan sir, a long history of 53 years of treating patients. Bhagwati madam, again, more than 50 years of treating patients in this domain. So SITARAM Ayurveda and SITARAM Ayurveda Research Foundation, Trishur also. I am very much thankful. And thank you for patient listening. Let us grow together. Let us learn together. And if you have any thing to talk to me specifically regarding the domain, I'm all yours. Thank you for patient listening. Namaste.
Thank you, Doctor. Thank you for this valuable session. Your presentation wonderfully highlight the depth and relevance of Vajikarana Chikitsa in current healthcare. Next, we have a Q&A session. Before we move on to the Q&A session, we have a brief product presentation highlighting some of our major Vajikarana formulations from Sitaram Ayurveda. Let us take a few minutes to explore our products. I think the screen is visible. Our first product is Ashwagandha capsule, natural adaptogen and for stress relief, strength and rejuvenation. Major indications are chronic stress and anxiety, fatigue, insomnia, reduced endurance. For 60 capsules, the price is 220 rupees. The main dosage is 1 to 2 capsule twice daily after food. Major combinations of SITARAM Ayurveda are for male reproductive health and vitality with Kabikachu capsule, for better weight gain and nutrition with the Ajashwagandha Lehyam, for stress, anxiety, sleep disorders, we can combine with the Brahmikritam. Major contraindications are hypothyroidism, acute gastric irritation, autoimmune conditions. These are the quality parameters of Ashwagandha capsule. Ashwagandha capsule has been tested through in-house QC and NABL accredited external laboratory. It meets all physicochemical quality standards, including weight uniformity, low moisture content, and a disintegration time of 15 minutes. External analysis confirms standardization with Vidafarin A at 0.078%, ensuring quality, purity, and sustainability of suitability for clinical and long-term use. Next product is Astra Plus, which is a Lehya formulation, a comprehensive Vajikarana formula for strength, stamina, and seminal health. Major indications are male infertility, general weakness, stress-related sexual dysfunction, age-related decline in male vitality. For 225 gram, there is 360 rupees for this Lehya. Major components are Kabikachu, Ashwagandha, and Vidari. It enhances sperm quality, libido, and reproductive strength. Shadavari, goat's testicle, cow ghee, sesame oil. It nourish depleted tissue and improve overall vitality. Next, pipali, cinnamon, and cardamom ensure proper digestion and assimilation. Ashwagandha and Kabikachu counter stress-induced sexual dysfunction. Honey, jaggery, and ghee enhance bioavailability and palatability. The dosage is 50 gram twice daily with warm before food. Major combinations are for stress-induced sexual dysfunction with Ashwagandha capsule, for urinary or prostate involvement, Chandraprabhavadi, for several fatigue, low testosterone symptoms with Shilajit. Major contraindications are acute fever or active infections, patients with uncontrolled diabetes, AMA dominant conditions, during acute inflammatory or congestive conditions, not intended for pediatric use. This is the quality parameter of Astra Plus. Based on physicochemical test result, the sample of Astra Plus is certified to be standard quality and suitable for clinical use as per Ayurvedic principle. The product demonstrates reliable manufacturing control, ensuring confidence for physicians in prescribing it for male reproductive health and vitality. Next product is Kabikachu capsule. It is a potent Vajikarana and neuro-rejuvenative for strength, fertility, and vitality. Major indications are male infertility, oligospermia, erectile dysfunction, neuromuscular weakness. For 60 capsule, it costs 250 rupees only. It majorly works synergetically on Majja Dhatu and Shukra Dhatu, enhances dopaminergic activity through natural L-DOPA while nourishing reproductive tissues. Ushna Virya and Snigdha Guna together support Vada pacification, improve neuromuscular coordination and sexual performance. Complements other Vajikarana and Rasayana therapies in infertility and debility management. Dosages 1 to 2 capsules twice daily after food. Major combinations are for general debility and Rasayana therapy. We can provide it with Ashwagandha capsule. For Parkinsonism, dopamine deficiency disorders, we can combine it with Brahmi capsule. For neuromuscular weakness and Vada disorders with the Shirabala 101 capsule. Major contraindications are acute febrile conditions, gut infection, patients on dopaminergic medications. Kabikachu capsule meet Ayush microbial safety standard with a complete absence of pathogenic organisms and is standardized to contain 130 mg of L-DOPA per capsule, ensuring consistent quality and clinical reliability. Next is an classical product, Nalikerasavam. It is for male infertility, oligospermia, sexual debility, hormonal imbalance, and skin pigmentation. For 50 ml bottle, it costs 210 rupees only. Major components are Nalikera, Ikshu, and Kunkuma. It nourish, ojas, and enhance complexion. Gokshura, Krishniparni, Brihati. It support reproductive strength and vitality. Villua Agnimantha Padaola balance Vada Pitta and promote tissue nourishment. Shalmali, Gambhari, and Dunduga rejuvenate depleted tissue and improve stamina. Cinnamon, cardamom, and clove enhance digestion and facilitate rapid absorption through the fermented base. Dosage is 5 to 20 ml twice daily after food, diluted with an equal quantity of water. Major combinations are Naligerasavam with Ashwagandha Lekhyam for male infertility and sexual wellness, with Shadavari Gulam for female infertility and ovarian support, Kunkumadi Thailam for skin pigmentation and complexion enhancement. Major contraindications are diabetes mellitus, hyperglycemia, alcohol sensitivity, acute gastritis, pregnancy. Next product is Testosap capsule. It restores Bala, Shukra, and Agni for all healthy weight gain in men. Major indications are healthy weight gain, muscle gain, relieves fatigue, improve metabolism. For 60 capsule, 540 rupees is there. Major ingredients are Ashwagandha and Kabikachu. It is Vajikarana Balya agents, improving Shukra and Mamsadadu quality. Musali and Gokshura, deep anabolic nourishment, enhancing muscle tone and healthy weight gain, enhancing stamina. Yashada Basma supports cellular metabolism and hormonal balance, aiding tissue regeneration. Shilajit act as a yogavahi, improve bioavailability and mitochondrial energy. Kunkuma improve microcirculation and tissue oxygenation, supporting metabolic activity. Dosages 1 to 2 capsule twice daily after food. Major combinations are for better weight gain and nutrition with the Ajashugandha Lekya. For muscle recovery strength with the Mahamasha Taila, external application only. For metabolic and digestive support with the Hinkwachadi Churna. Major contraindications are acute febrile condition, severe ama or indigestion, uncontrolled hyperthyroidism, uncontrolled diabetes mellitus. Astosap capsules meet pharmacopoeial quality standard with the validated physicochemical parameters and assured mineral contents, ensuring safety, consistency, and therapeutic reliability. We usually send certificate to all participants who attend the webinar for more than 75 minutes within 2 to 3 days. If you do not find the mail in your inbox, kindly check the spam, promotion, social updates, or career folder, and please save our email ID in your contact. support@sitaramayurveda.com. If you still don't receive the e-certificate within a week of the webinar, you can reach out to us on the number given below +918943441881. For notes and recording, please register yourself using the Google Form link given in the chat box and join the school platform. That's it for the product presentation. Next, we can go through our Q&A session.
May I just read and answer the questions from the chat box?
Yes, sir. I will read the question, sir. Sir, one question is, what will be the treatment for high liquidation time?
Yes. This is a very common repeated question in the chat box, entire chat box.
Yeah.
What will be the treatment for liquefaction and high viscosity semen?
Yeah.
So before that, just clearly understand that liquefaction is because of the seminal fluids which are coming from the prostate. Prostate is responsible for forming that coagulum of that semen. So from epididymis, basically only the sperms are coming out with some of the fluid, and the majority of 35% will be coming from the prostate and 20% will be coming from the seminal vesicles. If there is any issue with the both glands, there will be some kind of defect in the liquefaction time. One. Second, liquefaction automatically occurs after 15 minutes, 30 minutes, 60 minutes, even after 1 hour, 1.5 hours. It can happen. But parameters say less than 60 minutes it should happen. So that coagulum, which is the semen coagulum, which is coming in spurts, spurts, spurts out of the urethra into the either the test tube what we are checking or either into the vagina. It should go there and deposit. It should deposit. That's why it's coagulated. But within times, the enzymatic activity will start there and it will start into liquefying. That liquefaction is hampered when there is issue with the glands predominantly. Number one, I said. That viscosity also increase when there is some kind of issue in those seminal plasma or the seminal fluids which are coming from the both prostate and then seminal vesicles together. So if in the sample we are able to see sample is not liquefying, one thing, and viscosity is higher, we have to understand it at the level of gunatmak levels, which is the pichila guna is more there. And towards this pichila guna, we have to take treatment which is anti-pichila. It is as simple as that. It is a very basic understanding. So utilization of haritaki, utilization of loho bhasma, utilization of mandura, such kind of medicines easily correct the liquefaction time. I'll add one more point here. If in the lab we are not getting a liquefied sample or the sample is not getting liquefied, we in the lab have a process of manually liquefying the sample. Secondary, if I have to go for an IUI, intrauterine insemination, and I need a liquefied sample, yes, before processing the sample with some medias, I can liquefy sample myself in the lab. So liquefaction at multiple levels can be treated. If it is systemic, you give some internal medication which is anti-pichila kind of things, which is more of a kapha shamana kind of things. The liquefaction will come down easily. Loha bhasma is one of the potent medicine for this granthi bhuta, pichila, ati viscasa, like that kind of thing. And if it is in the lab procedure, we can manually liquefy the sample also. There is no, we have to just break those pectin bands in the semen. It will easily liquefy, no issues. So it depends where you have to, we are trying to make that sample liquefied. For viscous, yeah, again, go with more of less pichila drugs. Remove that pichilatto from the sharira predominantly. That's why it is being shown in the semen also. So multiple people have asked the same question. So it's simple. Basic answer is deal at the level of guna samprapti. It will be easily targeted. No issues.
Okay, doctor, thank you for the reply. Next question is how much kajali to be mixed with the tribala?
For they would be asking for sukshma trifla. It is not a. I'm I'm not 100% sure it's a classical formulation, but 1:4 they are mixing. It is a coming formulation coming from Maharashtra in form of tablets. So they are mixing trifla churna with kajali 1/4 part. So 1/4 or 1/8 as per if the kajali is well nirmit, there is no nishchandra in the kajali. Get it well checked if you are having a kajali in your hand and a trifla in your hand. If it's coming from the pharmacy, our scope is limited. But if it is made by ourselves, then Sukshma Trifla is one of the good combinations, specifically where we find some Jwara Samprapti, Shodha Sampraptis, Ama Sampraptis, infection Sampraptis. There, Sukshma Trifla is very important, a important choice of drugs. Like hydrosalpinx is a infection of the tubes. In that condition, Sukshma Trifla works wonder. So, Trifla with Kajali, 1/4 or 1/8 can be utilized. Yes.
Okay, doctor. Next question is this was actually we covered in case discussion 3 about IgG positive torch in females.
Yes.
So many
Yes.
questions are in the same
Yes.
area.
Yes, ma'am. So there are 2 to 3 questions. The first question is, what is this relevance of IgG in torch profile? Number one. Second question is, how much we will be able to give results to a patient if patient is coming with torch positive IgG? Second question. So I will give first question, first answer. That is immunoglobulin G is the antibody profile of the body which is responsible for the immune response. If there is long-standing some kind of infection, either bacterial, viral, protozoal, there can be rise of IgG in the body. While evaluating the torch panel, immunological panel in pregnant women as well as the newborns. IgG there indicates some kind of immunocompromised status, one, long-term standing immunological infections, and a history of immunology issues. If mother was having an issue, that can pass to a child. If, for example, it's a girl child, it can pass to a girl child. Then from girl child, if it is sustaining for long term, it can go into other child. Secondary. IgG can also be raised in so many immunocompromised status like HIV, cancers. HIV and cancer is not considered on the basis of IgG. IgG, if we check, we will be able to see, oh, there was a long-standing history of immunological pathology in the body. Body was immunocompromised since long. That means that that issue is something there. Second problem, will we be able to give a patient 100% assurance that, yeah, come to Ayurveda, we will be giving you 100% results? No, no. Immunoglobulin G, and specifically that in torch profile, if torch profile is being taken care of, we need antibiotics, antivirals, antiprotozoals. If it is torch profile. But if presentation is of Garbhapatana, Garbhasrava, I know my treatment line. If it is Jwara Samprapti, I know my treatment line. From that case report, I did not rated the torch profile IgG. I'm very clear about that. There was no intervention for IgG, no intervention for torch. It was the intervention for the presentation with which the patient has come to us. The lakshana with which the patient is coming is the abhyantar vikriti swarup of the patient. So my treatment protocol should line with that abhyantar vikriti, not the report. But at the what we call safer side, yes. When I know it's a torch profile, it's a big issue, I should confirm it with the patient. Patient should know everything clearly that it may not, it may. I will tell you one more case. We had a case of um, reactive depression disorder. That reactive depression disorder, what patient did was, the patient conceived, gave birth to a child. After 15 days of postpartum period, she went outside and with the child and came back without child. On the 15th day, it was found that she threw that child into the well which was in her courtyard. And when the police came, she was arrested for that also. So it was nothing. It was a postpartum depression. Sutika Janya Unmad with Acharya Charaka, Acharya Kashyapa has directly mentioned in Sutika Rogas. It was that she was not able to adjust to that phenomenon of having a child. So she threw that child into the this well. But when she tried for second child, she was relieved on some basis because there was no issue of paternal side, maternal side. Husband was good, everything was good. So she came out of the jail and she came for that Manas Roga and Vajikarana counseling. So we went for a profile of torch in that patient. We went for psychological evaluation. Psychological evaluation went well, very well, and we helped her. But in the second phase, when we went for torch profile, we just prescribed Guduchiyadi Kashayam from Sleshma Pitta Jara Prashandam, just a Guduchiyadi Kashayam, and we were able to see that the torch profile in that cytomegalovirus was raised. It came directly down. And the second challenge is she was mentally fit, kind of a lakshanic fit. Torch profile was not issued in that patient. So the patient is having a child of 11 years now. So first she threw in the well and second is living well. So Mansik Sharik Prakriti is the domain where we have to intervene, not the report. We are not here to correct the report. We have to correct the patient. The correction of the patient is much more important than correcting the reports. But yes, on the safer side, tell the patient the possibilities plus or minus both.
Okay, sir. Thank you. Next is how to approach a case of azoospermia due to sperm maturation defect at spermatid level.
So there are two maturation arrest, primary and secondary. Primary is when the germ cell is not going to make the spermatids, and the secondary is when the germ cell maturation is going to convert into spermatids, but spermatids are not going to convert into spermatozoa. Primary level, we have to rule out the basic cause, but in the secondary level, Shukra Janaka Dravyas are much more of importance in that. Shukra Janaka of two types. I will mention here. Shatavari is Shukra Janaka, Ashwagandha is Shukra Janaka. But ashwagandha is Shukra Pravartaka also, but Shatavari is not Shukra Pravartaka. Shatavari is Madhura Tikta Sheet Virya dominant, Shukra Janaka Dravya. So Shatavari is not a choice of drug in maturation arrest kind of things, maturation defects. Ashwagandha kind of drugs, which are Madhura, Tikta, Ushna Prakriti Dravyas, which will be empowering that Agni status in the level of Shukra, Dharakala, Shukra Sthana, Shukra Ashe, Retovasira. Because that kind of drugs will be able to help into the Shukra Janana as well as Shukra Pravartana. Pravartana from primary level to the secondary level and secondary level out of the testis. One. Shukra Pravartana. Pravartana both from the primary level to the secondary level and secondary level to the mature level. So in such kind of defects, if there are no genetic abnormalities, such kind of drugs on these principles can be applied. I am telling the principle, drugs can vary. Any drug can be used. This the principle is like this only.
Okay, doctor. And another question similar to this is, any remedy for azoospermatic in a cryptorchidism left testis? Patient with a normal hormonal values.
Yes. First and foremost, it is not a right methodology of a doctor who is knowing everything about the patient when he is knowing that there are undescended testis, cryptorchidism, which is undescended testis in the patient, and if the doctor is asking for some remedy in a azoospermic patient with an undescended testis, that means patient is of a sexual age, he has attained the sexual age, he would be indulging into some sexual intercourse. One point, he would have a choice of having an intercourse to have a child. In that condition, before having a child, it is our responsibility to make aware the patient that cryptorchidism is not a good situation in that patient. Cryptorchidism, if the patient has reached to the level of sexual maturity and still the tests are undescended, 100% there will be some issue. I'm making it very clear. I'll again rephrase one case. I will just narrate one case in front of you. We had one co-doctor in our previous institution with us. He just passed his BMS and then he was working as a medical officer in our college. Same patient, when I'm talking about BMS past, it is 25 years. His family was planning for his marriage. Then it was found that he suddenly started this general debility in the body, generalized weakness, loss of this appetite. Suddenly it manifested after 25 years. What happened? He was taken to a hospital where his entire examination was done. And the patient was found of cryptorchidism. Same. I'm talking same. One testis undescended. That one testis undescended was taken for biopsy. And it was seminoma of the testis. It was a cancer. And the doctor is no more with us today. He died nearly 5 to 6 years back. That's seminoma. If it is a undescended testis in a sexually fertile man, not azoospermic, it is a fertile man who has achieved puberty. First and foremost, our aim is to make aware that you just go for a either removal of the testis or some surgical correction of the testis or even the testicular biopsy of the testis. Before correction of the azoospermia, it is our responsibility to make the patient healthy in terms of some conditions which I talked right now. Seminoma is a very common condition. It is a cancer of the Sertoli cells, which is very common in non-undescended testis. So before treating azoospermia, you go for that. If there is no issues and if azoospermia is there, primary, please rule out one karyotype report. You will be able to report whether it is a genetic issue or non-genetic issue. If it is a non-genetic issue, please start on the Shukra Pravartaka lines, Shukra Janaka lines. If it is not if it is a genetic issue, please tell the patient if he is getting married, what are the complications. If it is not getting married, then complications. If he is already married, then just tell the patient to have either a donor sperm or some other options like adoption and other things.
Okay, doctor. Thank you. Next question is, what is the treatment protocol for male infertility with the bilateral varicocele grade 1 and 2?
So, why varicosity is a issue? Varicosity is an issue only when there is sperm defects, specifically morphology and motility defects, then only varicosity becomes an issue. From reproductive eye, from the systemic eye, varicosity is a systemic pathology which is going on in the sharira. There is Roto Rodo, Mande Agno, Aruchu Stimit Ashaya Samprapti is going on there. And that's why the entire Samprapti is localizing into the testis. The metabolic error is there. We have to correct that to make a good healthy body. But if a patient is coming to me with a grade 1 or grade 2 varicosity, and if there is no sperm defects, we can go for a healthy coitus. There is no issues. But if in grade 1 and grade 2 we are having sperm defects, we have to deal accordingly. Varicocele grade 3 is the treatment choice stage. But 1 and 2 are not that much treatment choice. In Ayurveda, we have to go with predominantly Siraj Granthi from Sushruta can be taken into account. Dhatu Shaithilya from Pandu spectrum can be taken into account. Stimitashaya Samprapti, where that oxidative stress, that Mandagni, that Soto Rodha Samprapti is taking into place, can be taken into account. The Shota Samprapti, Bahesira, Prapyada, Kapasrik Pittani, Sandushati, Havayu, Tair Baddha Margaha, Visarpat Utsed, Shotlingam Shatu Karoti. That Samprapti can be taken into account. Rule out. If the varicosity is coming with a metabolic disorder, if the varicosity is coming with pain, if the varicosity is coming with kandu, if the varicosity is coming with a nilabh kind of thing, that there is a uttana vatrakta kind of presentation, vatrakta samprapti can be taken into account. Rule out what the patient is presenting to us. Varicosities can be treated with simple drugs like Tikta Kashaya, Sahasradi Kashaya, Lakshadi Gugulu. I gave 3 different combinations. So combination is not mattering here. Protocol, the approach is mattering, and that's why whatever treatment you will be giving based upon your yukti, it will work. 100% it will work.
Okay, doctor. Next question is how to treat hyperprolactin of more than 100 in males?
Yes. So when you are getting more than 100, you have to go for pituitary evaluation first and foremost. It can be a tumor in the this pituitary, which is secreting this much of prolactin in the body, primary. So if it is 100, you have to check. 100% you have to check. If it is raised 2-fold or 3-fold, then only we can help the patient. But prolactinoma is the term. Prolactinoma is the term. Prolactinoma can be diagnosed based upon this MRI and advanced radiological techniques. So if patient is presenting to us with 100 prolactin level, first and foremost, rule out prolactinoma in the patient. If prolactinoma is not there, then this modern medicine is giving this treatment, which is known as cabergoline for prolactinoma. So if devoid of that, if patient is taking that medicine, if it is not coming down, we have to rule out some different samprapti. It is not just a hormone-based samprapti in the going in the patient. Rule out what is the presentation of the patient, number one. Rule out what is the evaluation of the patient. Rule out how the patient is responding to the drugs. Example I will give you. The patient that I showed in the case series was anti-TPO positive with prolactin positive. So Rasna, Dashmul, Rasna is such a combination which is predominantly we have seen and we have learned from our teachers that it is working where that there is some immunological compromise going in the body. There are some antibodies which are making the body weak or immunocompromised. There, such a medicine will work, and it worked. It worked. So prolactin is not the thing which is of interest to us. Interest is the presentation. But please, if it is more than 100, please rule out prolactinoma of the brain. It can be a option, it can be a choice, it can be a catered decision, it can be a evaluation pathway, anything, but please rule out this in that patient before it gets late. And if it's not working on both levels, yes, there will be some options for us and the other domain of the science to help the patient.
Okay, doctor, thank you. Next question is, can we give Uttarabasti in hydrosalpinx? If yes, which Thaila or Grida can we use?
Hydrosalpinx is a condition where there is some kind of infectious pathology going on in the fallopian tubes. Ayurveda says it's a Uchitapatha Margavarodha Janya condition. Uchitapatha is that fallopian tube where from where the egg will be coming out. It is Margavarodha Samprapti due to some dosha dosha samochana. We are clear with that. The Jwara Samprapti can be taken into account, the Shota Samprapti can be taken into account. So at the primary stage, what our motive should be, it is to resolve that hydrosalpinx, that amatva condition should be removed from that point. Primary condition. As and when we are able to achieve that amatva shoshanatva in that point, we will be able to give the uttarvasti. Primary state. Primary state doesn't mean that there is resolved, the hydrosalpinx has resolved. No. Primary state is that dosha dosha samochana we are able to break at some point. So Amritottaram Kashayam is one of the, see, such a beautiful combination, easy combination. It will be helping very well. It helped very well. Kapha dominant Prashaman Kashayas can be of very help in that. Punanavadi Kashaya, Punanavashtaka formulation is very, very good in that. Nikhila, it is Sarva Dosha Jwara and Shosha Prasamana with Pandu Samprapti. Same combination where there is Margarvajuna Samprapti. Once it is resolved, or once you feel like that the primary hydrosalpinx condition is resolved, we can go with the Uttarvasti. Now, Uttarvasti with Sahajradi is a very good option. One, Shatpushpa Tail is a very good option. Two, Rashmula Tail is a very good option. Yeah. I am not telling about Kshirbala 101, Dan Mantram, no. We have to give more kind of a Ushna kind of things which are more of Pachana Dravya Sadhita and which are more kind of a Padutitrashaya Ushna Dravya kind of things. So that spectrum of Uttar Basti Dravyas will help in resolving of that hydrosalpinx and maintaining that tubal patency so that the fallopian tube patency can be maintained and we will be able to achieve that sammita in that tube. And one day when the fertilization will happen, there will be sort of healthy endothelium layer. The layer of the fallopian tube will be good. It will not be hostile for that sperm and ovum. So primary stage is Ampachana, secondary stage is Uttarvasti. Simple.
Okay, doctor. Next with the case discussion, that is a female aged 37 age with a history of 2 previous medical terminations due to trisomy 21 with the Alpartava, 2 days, 1 pad per day with a normal semen analysis in husband. Now, can we think about further treatments? How we can think about the chromosomal abnormalities?
Yes. Primary factor is she's a female. Secondary factor is she is 37-year female. And third factor is MTP due to 21, Down syndrome. So it is a classical presentation of Down syndrome at the age more than 30 years. That is the complaint of the patient. What the patient is coming to us. But if the patient is coming to us with that complaint, the presentation is varying. The presentation is Alpartava. If, number one, if the patient is primary infertility till 37, we have two options. One to give a right option and one to give an option. Right option is to take up a donor sperm if there is male factor issue also, number one. If there is no male factor issue, then the secondary option is to adopt. But this is not our way because we are treating a patient. So we will go for an option. Option is treating the patient so that we can have a healthy garbhashaya and shonita prakriti so that we can achieve a healthy pregnancy even at the age of 37. Fine. Which needs proper female evaluation, proper male evaluation. Both evaluations are proper, but patient has a history of 21 number chromosome trisomy. Age is increased. Increased age cannot be reversed. Then we have to go for a proper follicular monitoring. If ovulation is good, follicles are good. Follicles are not like dormant follicles. There is no ovarian failure kind of things. Go for a fecundability period and tell the patient to have a intercourse. But before intercourse, there should be a complete protocol regimen for a female so that we can make that complete sharira, garbhashaya, shonit a proper apradushta. It is not a dushta, but apradushta we have to maintain. We have to maintain the patency of everything from our side so that if the conception happen, there should not be any genetic abnormalities. One thing. Second thing, if the conception has happened, we will be able to give our modalities to the patient so that the conception is maintained properly. But since all this is what we all are knowing, I will add one more point to this. If there is pre-genetic testing or pre-genetic counseling, is a newer age thing what the people are doing for genetic issues. Yes, it is recommended that you go for a pre-genetic counseling. If still there are issues, there will be options. It is not like it's at 37 they cannot conceive. They can conceive. They can conceive without child having the issue. And yes, Ayurveda can help at all stages. Just a catered, a chota, there is small, minute things where we have to intervene and we can help the patient even if it is trisomy 1, 21, age is 37. If everything falls good, patient will be able to conceive easily.
Okay, doctor. Thank you. Next is treatment for increased level of FSH. Also, azoospermia, where FSH is high with the normal testosterone, LH, and prolactin.
Yes. If the FSH is high from the brain and testosterone is normal or low, rule out hypogonadism. There will be more secretion of the hormone from the brain, but it will not be reaching into the testis. And even in that case, if you will be giving more testosterone to the body, there will be complete negative suppression to the FSH. So in such conditions, you need to rule out testis based upon Sertoli-Celloni syndromes and other complex abnormalities in the testis predominantly, because FSH is coming good from the brain, but say, testis is not metabolizing and producing the testosterone in that condition, which will be helpful for the patient. So it could be a case of Sertoli-Celloni syndrome or primary or the testicular failure predominantly, where the testis is not responding to the FSH. So evaluation is predominantly needed in that patient.
Okay, doctor. Next is infertility due to bicornuate uterus causing repeated abortion.
Yes, it's a bicornuate uterus. It's an anatomical abnormality. You have to go for either uterine reconstruction or other options. मतलब you cannot just go blindly कि we will be giving some uttarvasti and something will be happening. No, it will not happen at once. For years long, if you will be giving some uttarvasti and other things, some changes we can appreciate. But no, if it is a bicornuate uterus, you have to have an anatomical correction in that. And if anatomical correction works, well and good. If not, you have to check for other options also.
Okay, doctor. What about corneal blocks?
Corneal block, I said the same thing. For the fallopian tube block, you can go with the same thing. If a hysteroscopy is recommended in that patient, see, corneal blocks can be due to tuberculosis infections. So go for a acid fast bacilli test. If it is present there, ultrasound is not giving a right image, go for a hysteroscopic analysis of the tubes. If it is corneal block, we can go for a chromopertubation through hysteroscopy, followed by some sittings of Uttar so that we can maintain the complete contour of the uterine cavity and the tubes. So even after a TB, we can achieve a very good healthy uterus for 2 to 3 cycles if we are getting this Uttar in corneal blocks after chromopertubation. When we have removed the avarodha and after that we are going for Uttar it will help. Yes.
Okay, doctor. Next question is, how will be the treatment protocol for premature ovarian insufficiency?
Premature ovarian failure is a very alarming issue in today's young growing females because of their lifestyle disorders. So premature ovarian failure is diagnosed based upon the AMH values. If AMH fall less than 1.0 in the 20 to 30 year of age, the ovary is going into this suppression. It is not going to make new eggs. It is not going to deploy new eggs. And if it is such kind of a composition of the ovary, one you go for anti-malarial hormone screening, and if the periods are even scanty or if periods are anovulatory, if periods are good, or patient is DUB also, you check second day transvaginal ultrasound. If it is permitted, if it is not, if you can go for transabdominal also. Check for AFC. Specifically, you write in the ultrasound requisition that I need how many follicular count is there in both ovaries. Check the volume and other things. Now we have come to a conclusion that it is an AFC cell, the count of ovarian cell is less, reserve is also come less. So it is very well managed in Ayurveda. That's the problem that the other science is responding to this in a kind of a negative way, but in Ayurveda we are able to produce very well results in premature ovarian failure, uh, pre untimely ovarian failure. So treatment line goes based upon Artha Dushti only, Artha Kshaya only. Some protocol I will be giving. It is a basic protocol. You can do plus minus based upon your permutation, combination, presentation of the patient. One thing is start with some kind of Shodhana therapy at the level of Pakvashe level. Once the Srotovarodha, Agni Mandya, Achalatva is removed from the Pakvashegata level, the Agni will be maintained there. The Samana Vayu, which is responsible for that kindling of that Agni at the level of Garbhashay and ovary, will be very well maintained from a Virechana. Do a Virechana with some kind of things where we not only go just for Grita Prayoga, you can utilize a Yamaka Prayoga also. Like sometime I utilize Phalagrita with Mahanarayan or Kalyanaka Grita with Narayana, some kind of, or Sahajradi even you can use. Not equal, disproportionate Snehapana can also be used. Following that, you can easily go for some line of management which is Artava Janana. Artava Janana in the sense, Tailapana is one of the choice of drug. Mahanarayana Tailapana is very good in that. But oil intake is not that much feasible to the patient. So soft gel capsules can be utilized in that. Shatapushpa Churna with Ghrita in the morning, empty stomach, do both karma. Apana Vatanalomyam, Apana Dosha Dushti Shamana, as well as Rasayana. It's a Abhuktakala Rasayana effect. Internal medications like Kumaryasavam, Bringaraj such kind of medicines will be helpful in that. There is a, you just do not blindly give Raja Pravartini in that. Raja Pravartini is not going to do that kind of help in that. Target that system where that issue is going on. That ovary, that fallopian tube, that uterus, that cervix is itself a Sharira where the Sharirik Dushti is going on. So consider it as a Sharira in the Pakvashe Sthana where the Agni Dushti is happened. Based upon these principles, you either opt Jwara Prakarana, Rakta Pitta Prakarana, Yoni Vyabhada Prakarana, Vatraka Prakarana, Vata Vyadhi Prakarana, it will be helping. Because the Yukti will not change, the system, the understanding will only change. And based upon these basic protocols, we are able to achieve scanty menses will be regularized, DUPs will be controlled, Pradhara, if it is non-ovulatory, it will be going to get controlled. And with time, the regularization of menses will be there, and somehow we will be able to achieve that good deployment of those eggs by the ovary to generate new healthy sperms, ovum. And if it is getting right, we understand that FSH is coming good, that estrogen is well maintained, that progesterone is well maintained. The entire hormone profile at the systemic level in the ovaries and the full body level is getting regularized. So premature ovarian failure is not a big deal. Just try taking the steps based upon the Ayurvedic Samprapti, nothing else. Of Artha Dushti Chikitsa. Yes.
Okay, Doctor. Thank you. I think we have covered a lot of questions with our limited time. This is the final question from my side. That is, considering the rising prevalence of infertility, delayed parenthood, decision taking, and late age conception in modern society, what do you see as the future scope of Ayurveda in the field of preconceptional care?
Preconceptional care begins when you take a decision that I am going to get married. And as in when you get married, there is a liability of the husband and wife to have a child. Keeping aside that we two are not ready to have a child and we will never have a child. That is something different. But in a general pattern, we will be having a child one day. So, what is the role of Ayurveda? Ayurveda works at a level where our putra, our prapotra, and our praprapotra should be born healthy. A 3 generation at least should be born healthy. To make those 3 generations be born healthy, how much responsibility I am carrying on my shoulders as a upcoming father. So, where Ayurveda play a role? Ayurveda play a role at a level where my Sharira, Manasa, Atma, these all are in such a situation that when my man is happy that I will be producing a child who will be uh, manasik swastha on the levels of mana. He will be Ragadi Rogarahita. He will be Sushruta. He will be Vagbhata. है ना? Those, he will be talking nicely. He will be learning nicely. Those components. My body should be healthy. My parameters of semen parameters, my body parameters, my metabolic stress, my metabolic errors in the body, my diabetes, thyroid, everything should be controlled. And before controlling, it should not be there if I am following a Ayurvedic lifestyle. Still, if I am not following a Ayurvedic lifestyle, it should not hamper my reproductive health if I am creating an infertility spectrum for myself. And if I am having a child in my hand, me and my wife will be aging with some days. And then comes the role of Rasayana, that we should start taking some Rasayana so that when my child sees back me at his or her age at a 25, when he's of putra prapti avastha in the next generation, when he's trying for fertility, he should see me back, that my father is a Ayurveda follower, and this is how the Ayurvedic lifestyle take place. And this is how I have been made from that elixir of Ayurveda, copious form of Ayurveda. So Ayurveda, what we are there to give Ayurveda, if it has sustained from last 5,000 years, it is going to sustain from next 5,000 years also. But what we are able here to do is, we should do that precision Ayurveda practice where we are able to help someone who is in need of help, because Jwara will come down in 2 days. Your Shotha will come down in 2 days. Your pain can be treated with a balm or something, oil or something. Your foot is getting gangrenous. You can cut off that foot, but you cannot cut off your people from your life. And having a child is one of that thing. And if we are able to help that patient in such a situation where that mano daurbalya, deha daurbalya, atma daurbalya, it's everything is sitting in the patient, Ayurveda can be a hope of light for that. And there is where we have to intervene from our side.
Thank you, Doctor. That was a wonderful Q&A session. As we come to the end of today's session, I would like to express our sincere gratitude to our esteemed speaker, Vaidya Dr. Pankaj Sharma, for delivering such an insightful and enlightening lecture on practice of Vajikarana Tantra as a speciality, a roadmap for precision reproductive medicine. Thank you once again, sir, for this wonderful session. We truly appreciate your valuable contribution and look forward to learning from you again in future. I would also like to thank all the doctors, panelists, and participants for their active presence and enthusiastic participation, which made today's session truly meaningful and successful. Thank you all once again. We look forward to meeting you in next episode of Acharya Rasayana. Thank you.